Got it.
Are we there?
Fix the-
Okay. I'm Commissioner Ed Rothstein. It is November 30th, the last open session in November. Cannot believe we're going into December tomorrow, but regardless, with that said, let's as always stand for Pledge of Allegiance and a moment of silence. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. I don't know about you all, I love that pledge. It's a good way to start in the morning. As always, let's find out what is on our minds and my colleagues' minds and go through Priority Carol. And then as shared, what we'll do is we will recess, go right into the Board of Health and finish that up, reconvene into open session, and then we'll go from there. So with that said, for Priority Carol, Commissioner Vigliotti, what's on your mind?
Well, thank you very much, Commissioner Rothstein. I hope everybody had a good Thanksgiving, and I want to take a moment briefly to thank our law enforcement, corrections, and those who serve in fire and emergency services, as well as public works and other areas who were working during the holiday. We all appreciate and respect and thank you for that. So over the weekend on Small Business Saturday, I was all over District 1 between New Windsor, Union Bridge, and Tawnytown to visit small businesses, crafter, vendor, artisan shows, and local events. And it's always amazing to me to see how much talent and entrepreneurial spirit there is here in the county. And the other really cool thing is that when you go to all these different places, you run into good people you know and to friends you know, including Deputy McGinnis, who serves the Union Bridge and New Windsor area. In Tawnytown, I got to meet the new Chief of Police, Adrian Baker, who's looking forward to not only serving Tawnytown, but working with our sheriff, of whom Chief Baker had very good things to say. And I'm grateful to see this as we, as the county, benefit from a shared working relationship with our municipalities. Earlier this week, my fellow commissioners and I had the honor and privilege of attending the Department of Fire and Emergency Services pinning ceremony for parts of classes 2, 3, and 4. I know we all enjoyed being able to participate in that ceremony and getting to shake the hands of the men and women who we will in turn rely upon for our safety. The next pinning ceremony, if I'm remembering correctly, is on December 11th, and I certainly encourage anyone who's interested to attend and cheer everybody on. I also had the privilege this week of attending the meeting for the Carroll County Commission on Aging and Disabilities, or COAD. They're wonderful people dedicated to serving the elderly and those with disabilities. And of note, COAD currently has openings for the commission for individuals to represent Manchester and Finksburg. Any interested candidates need to reside in those respective areas and would be most welcome in applying. And it was asked that I share the following information relating to that. The responsibilities and duties of the commission shall be to review, evaluate, and comment on area plan objectives as drafted by the staff, to serve as a steering committee for the prioritization of programs, to bring before the COAD needs and issues of the senior citizens and adults with disabilities of Carroll County, to develop positions on legislative and other issues of concern to the senior citizens and adults with disabilities of the county, to advise the county commissioners on program and fiscal matters relating to COAD and funding of programs and services for senior citizens and adults with disabilities, and to review and comment on the annual budget prior to submission and assisting staff in developing strategies for coordination with service providers and other agencies. Again, anybody who is in the Manchester and Finksburg areas are welcome and encouraged to apply through the county's website. And Commissioner, that's all I have this morning. Thank you.
Sounds good. Commissioner Kyler.
Good morning. And it's been a busy time with Thanksgiving holiday. Hope everybody had a great time with family, friends, or however, whether you traveled or stayed home, had a great holiday. In the past 2 weeks, I've gotten to see Commissioner Rothstein's town hall, which was a good event.
Thank you.
Veterans Advisory Committee, which is always good. The Fire and EMS pinning, which Commissioner Vigliotti already discussed. I got to go to the Boys and Girls Club Big Chill, and that was interesting. It was great to see so many people there. It's Terry Smack beat Ed Singer, and so he got to be dunked. I think we're going to see it almost live. And while I
You
supported,
splash.
yeah, he splashed a little.
Wow.
While I supported both, I was hoping they'd tie and they both go in, but didn't happen. And Mr. Singer, fortunately, I changed out of my suit. He left the tank, walked into the building, and gave me a great big hug while he was all wet. So, fortunately, I was in clothes that didn't hurt anything. But just a great event. So many great people there. The Boys and Girls Club does so much. And I think they made $126,000.
It's actually higher than that. It's up
Was
to
it higher?
130,
Wow.
130.
That's amazing.
So, which was higher than last year.
much higher than last
Yeah,
year. Yes.
so great event, a lot of fun. I also went to J&P's one evening. They gave 20% of all income that if you showed the coupon to Hampstead Fire Company. So it's great to see J&P supporting the fire company and the fire company doing stuff to raise money. That was super. We've worked on budget, as we always do. I was lucky enough to be invited to Hereford Optimist Club, and I got to see what Hereford does. They always try to do 6 students, 2 from Hereford High School, 2 from Hereford Middle. In the past, there was a local private school that since closed, so they went to North Carroll. When North Carroll closed, they went to Man Valley. So we were lucky enough to see Dean Groth and Kathleen McCormick, both representing Manchester Valley, get the Hereford Optimist Club Youth Appreciation Award, and it's nice to be there. It's nice to see these kids and families. We hear so much about the negative stuff kids do, but then you see kids like this. I think he's working on his Eagle for Boy Scouts, and they've both done so many great things, and it was really nice to be invited and see that. Coming up, we have Realtors Luncheon on Friday, and Stanball's in Union Bridge. Charlie Stanball was a great competitor and great friend over many, many years. They're celebrating their 50th anniversary for that business. Shannon and Ryan now run the company. Charlie has passed, but a great company in Union Bridge. And I think we're going to be lucky enough to see the tree lighting in Union Bridge and fit that in. I'll give you the time schedule, but it looks like we can.
Awesome.
Well, Commissioner Vigliotti wants to do both,
I think we can do it.
and I think we can. So that's coming up, and I love Carroll County. I love the groups, and I'm done.
Sounds good. Commissioner Gordon.
Thank you. As my colleagues all mentioned, I hope everyone had a wonderful Thanksgiving. Obviously, it's a good time to take a break, enjoy time with family and friends, and just decompress from all of the year to date. We've all been exceptionally, I think, busy this fall moving into the winter. None of us have that exception of not being. One of my recent visits was I toured Kenora Brake with members of economic development as well as workforce development. An incredible gem in the county. Some people may not be aware of this, but their 235,000 square foot building is the headquarters for the North American operations. They also, besides employing hundreds of workers, they create a lot of efficiencies in their processes, which is fabulous to see. The building rooftop also has solar panels that provide 50% of the company's power. So they're utilizing solar within the business, which is wonderful to see within the community here. And, for having a global company here in our backyard like Kenora, I think it's an incredible benefit to the county. And, we talk about ag a lot, but we also have a lot of industry here. So don't be surprised to learn some of these, I won't say hidden gems, but gems you may not be aware of.
They're expanding, right?
And they are expanding, yes. Recently, right before Thanksgiving, myself, Commissioner Vigliotti, and Commissioner Kyler were fortunate enough to go over to the Farm Museum for their opening of their exhibit, Stitching History, which has to deal with the barn quilts in Carroll County. It touches a little bit on the barn quilt trails, but also a variety of historical quilts and coverlets that have been donated by local families. It was nice to see part of this permanent exhibit that's in place now, and there will be some additional quilts as they rotate out and some history regarding that piece of Carroll County. And always a pleasure to see our wonderful people over at the Farm Museum. This past Saturday evening, I had the pleasure of riding along with Maryland Youth of the Year, Jalen, who's our Maryland Youth of the Year, who's also from Carroll County Boys and Girls Club. I was also there with the respective elementary, middle school, and high school Youths of the Year from the club, and we were very, they were very cold. I was sitting in the front with the heater on, but it was a fun time, and it was just impressive to see on even a cold night the amount of people that turned out in Westminster. I mean, I don't think I've seen a parade that deep. I mean, it was 6 and 7 people deep in line. I think it ran about an hour, and it was just an impressive turnout to see community come together for the holidays. So it was always just wonderful to see that. As Commissioner Kyler mentioned, on Giving Tuesday, Boys and Girls Club, there's myself with Doug Velanoski from Velanoski Wealth Management, and there we have Ed Singer and Terry Smack. Incredible day to see people turn out and truly be put into frigid water, and especially on an afternoon that was just incredibly cold. It was always great to see. We had a competition between McDaniel and the community college as well. And just, it's great to see the community come together for any of our organizations, but definitely about the kids. Another event that was mentioned briefly, which the majority of us were in attendance, was the fire pinning the other night. That was impressive to see the turnout with that. But I did want to mention a couple other events that are coming up. We've got Carroll County Times, as always, is doing their Holiday Hope for a variety of different organizations, Shepherd Staff, Carroll Food Sunday, Caring Carroll, I believe, Bridging Life, and Hoffa Foundation. As always, we're a great community. We support each other. We support all our nonprofits and everyone. I just wanted to mention that one as well. But I also wanted the other one you're seeing up there, which is coming up on Monday, December 11th. Paradiso in Westminster is hosting an evening where 20% of your check will go to the Be a Ray of Sunshine Foundation. Sometimes it's very, I guess I'd say, difficult to see how some of these organizations start, and while they're doing great things, you almost wish that wasn't the case, that they'd ever be formed. I know the family that's involved with and founded Be a Ray, and what happened was a year ago, Mackenzie Ray Cash, who was a student at Westminster High School, passed away in December of 22. She was an advocate for anti-bullying, loved volleyball, loved her pets, wanted to be in the military, and eventually be a nurse. This foundation was set up in her honor to support others. Part of this is looking for kindness and compassion in the community. The primary purpose of this is to execute anti-bullying initiatives, provide awareness and resources for youth mental health issues and scholarships that interested Mackenzie. It's incredible, and I know we've all grown up around it, and yes, even as adults, sometimes you get bullied and harassed, but some of what goes on with our youth today is just absolutely shocking, and just, I can't even put into words how just incredibly bad it is. And I just wanted to bring this up today because, one, we need to be a compassionate community, and yes, you'll drive through areas like Westminster, and I know there's other signs in the county, and you'll see the Be Kind signs, which that's another entity in the community. But I think the real thing we need to realize is people are dealing with things every day. And none of us are perfect, and we all struggle. And if there's anything to be learned by this, it's, try to be decent to one another, and definitely try to make sure that our kids aren't bullying and affecting other people in the community. Because with social media and everything else, it's gotten incredibly toxic. They can't get away from it, and that causes a lot of other issues in mental health. But I wanted to mention that as well this morning. And last, I will be tonight at 6 o'clock at the Carroll County Veterans Independence Project is holding their tree lighting. It's their 3rd annual. Last year, I think they had over 90 plus baked goods that were donated in honor of that. So I'll be there this evening at 6 o'clock. And that's all I have. Thank you.
Okay, fantastic. And just to share, although some of us may use scripts, we are not scripted. And sometimes, most of the time, we don't know what the others are going to share up here in colleagues. So I do appreciate Commissioner Gordon going down that road about the B of Ray sunshine. That's huge. So especially this time of year. Commissioner Guerin, what's on your mind?
Good morning, Carroll County. So I'll start off by, I wanted to thank the Heidelberg Cement Facility, commonly known as Lehigh, for a tour they provided to me last week, the day before Thanksgiving. Just really appreciate a fantastic facility. The more I spend going around the county, you see great businesses, large and small, great opportunities here in Carroll County. So I want to thank Paul and Vince and Kent again for making me feel so welcome. And for all the dads out there, the coolest part was that my two daughters actually wanted to come with me to the cement facility. So that was probably the coolest part of all for me, and they're not afraid of heights at all. So that was really enjoyable, and that was kind of a cool way to start off the Thanksgiving break. I want to highlight, as a couple other commissioners did, some great things going on within the county for the holidays. Some great stuff going on down in my favorite part of the county, Mount Airy, Winfield area. So on December 3rd, this Sunday, let me back up. December 2nd is Saturday night, is the Mount Airy Christmas tree lighting from 5 to 7:30. And I have been asked to actually participate in that, so I'll be down there. It's just down the street from me. So that is Saturday night in Mount Airy. If you're anywhere near the area, please come. It's like everything that we do in Carroll County around the holidays. It is just a lot of fun. And if you haven't been to Mount Airy, downtown Mount Airy lately, you should go back because it's changed a lot and there's a lot of things going on down there. So that's the Saturday night. And then much like last year, we've got some volunteer fire departments throwing their pancake Santa breakfasts in December. So the Winfield Fire Department will be holding their Santa Claus pancake breakfast Sunday morning from 7 to 3. It's at the Winfield Fire Hall there. I will be there. If you want to talk to me, you got to come and spend some money and eat breakfast, and I'll talk to you. But I do not get special treatment from any of those folks there. I am just clearing tables and taking out trash. So that'll be the 3rd, the morning of the 3rd. Please come. It is a fantastic event. Very, very a lot of fun, and you're supporting a great cause. You're supporting your volunteer fire departments. They are still out there, and they're still out there every single day. And then on December 17th, and I'll mention it again, will be the Mount Airy Volunteer Fire Department's pancake breakfast, and that's going to be from 7:30 to 11 on December 17th. And if you can't remember quite exactly where it is, it's not the fire station, it's the carnival grounds across the street from Weiss and the Home Goods, which is the busiest store maybe possibly in Maryland right now. And it's right there in Mount Airy. So that'll be December 17th from 7:30 to 11. I'll mention it again, but just some great events to come to in Carroll County. You don't have to leave the county for some of these things, and great causes. And that is all.
Cool. I think I now know why Santa's so fat and jolly. He eats a lot of pancakes.
Yeah, there's no question.
He'll be down in Sykesville on Saturday during the day, and he'll be moving around pretty quickly, I think, throughout the weekend and all the way up through Christmas. A few things I just want to share. It's been, a couple weeks. I did have, opportunity yesterday. The state's attorney holds a presentation to 11th graders throughout the public schools in Carroll County, and it's opiate prevention and teen support. And it's about an hour-long program, and it's not designed to be a scared straight program. It's not designed to, tell the kids, these 11th graders, how wrong they are by making, poor decisions. It's designed to share experiences that folks have had, and there are choices that we all make. Tim Weber from the state's attorney, very proud to call him a friend, along with understanding his journey and his challenges. His daughter, I believe it's Amanda, came up and talked afterwards, and how their relationship has been built over time once it was lost during his, addiction. And she was also very challenged, but now they are, together. And those are the stories. And she's, relatively young and sharing this with 11th graders. It resonates. What also I liked about it was our sheriff and his team was also present there, and it showed the collaboration and the team that it's a community, to make things happen. This woman right here with the red top shared her story. She's a mom of 3 young men. One, unfortunately, died of an overdose, I think back in 05 or 06. They were from Liberty High School. And the video, was her speaking along with her 2 children about the loss of their son. And it's tough. I mean, it's real. As I looked around, I saw just a lot of attention from those 11th graders. It wasn't, a full auditorium, which I like, because a full auditorium, people are on their phones or doing all this other junk. This was a confined group, and just very impressive, opportunity to listen and learn from what's going on. And I think and I'll get off this in a second, one of the difficult things was, in the very beginning, the first 5 rows of 11th graders were told to stand up. And they said, this is about the size of folks that will not be here when you graduate. About 50 folks, or 56, I think it was. And I was like, wow, that's pretty powerful. My son's a long-term sub right now into high school, and he was listening to this, and we came home, we talked about it, because it's real. So strong appreciation to our state's attorney, his entire team, our sheriff and his entire team that were there, along with CCPS. And I think they're doing Liberty High School next week, and they're going to be moving around the schools. And then I believe they're going to go to the middle schools. But really a good opportunity, and I appreciate being invited to attend. Last Monday, it feels a world ago. It's a pretty typical picture of me. Look like a duck. But anyway, I had a town hall. And the way I do my town halls is I have one in the morning, one in the evening. And I just say, okay, here's what's happening in Carroll County, especially in the Sykesville-Eldersburg area, from south to north, east to west. And then I just open it up for questions and discussion, dialogue about some of the developments and concerns, whether it's traffic, crime, development, overdevelopment, and I just keep it open. And I appreciate the candid conversations. I get follow-up discussions from the community. I also have a strong appreciation for our citizen services, the senior center, who facilitates and allows me to use their space, as a good venue. And then also our team, from our administrator, Roberta, on down to my rest of my colleagues and my staff, that they're committed to answering, and they answer some of the tough questions, and then they have their contact information for anybody that wants it or wants to follow up. It really shows that the commitment of our staff, they don't see it as a job. They see it as a commitment to the community. And because I do evening events, and they're there, and they're like, yeah, there's no issue. This is part of my career in helping a community. So thank you openly to our staff, our senior staff, and everybody to make that happen. Another topic that Roberta and I, and actually DPW, Brian Bokey, also participated in was yesterday, I think, whenever it was, Tuesday? I can't remember. It was one of those days. We went to down Eldersburg, Sykesville, American Legion.
Tuesday.
Was it Tuesday? I can't
Every day
remember.
was really, really cold.
I don't know. But yeah, it was really cold.
Really cold.
So, apologize being a little tongue-tied on this. It was decided that a VA home was to be built, a second VA home in Maryland. And I've talked about this often over the last few years, but it's really starting to come to reality. Charlotte Hall is a VA home that is, established here in Maryland, but they need a second. So it was determined that Carroll County was going to be the home of the second, and it's a 125-bed, state-of-the-art facility. 35% funded by the state and 65% funded by federal government. And we get the opportunity to resource it, so we're talking to McDaniel and Community College and, CCPS on folks that may want to grow into those careers and run a facility like this VA home. But we went to the site, and it's on Slacks Road. And if anybody knows Slacks Road, it's a very difficult road. It's very narrow, very windy, and it's going to be a big challenge. The Secretary of General Services, DGS, has committed to working with us and with the rest of the state in widening Slacks Road and making it a much better road for ingress, egress into this facility. So the meeting we had the other day was with the VA Deputy Secretary along with DGS on these are the next steps. We already have A&E Architecture Engineering that's looking at this property, but I'm sharing this because it's real and it's exciting. A $185 million project coming to Carroll County and not using our dollars. I love that. So, and taking care of our veterans. The last thing I want to share is about our veterans. It's been a bit of a gut punch for me the last couple weeks as two very close friends and mentors have passed. One I mentioned the other day, it was Secretary George Owings, who battled cancer for a very short period of time. He was former secretary. He was also a delegate for a long time in Maryland, and he was the poster child of a Marine and of a veteran in taking care of our state. I'm going to his celebration of life on Sunday. Recently, another very close friend and mentor, Erwin Burtnick, Colonel retired, passed away, and I went to his funeral yesterday. And Erwin was never short on any words. The guy could talk and talk and talk, and he ended up walking away. Not to be disrespectful, but you could never get away from somebody that just keeps on going. But he was an amazing guy that took care of our community, our veteran community. He followed up with a soldier to get the soldier the Congressional Medal of Honor. That took about 2 years when he was told he could never get it done. And he's like, you haven't met me yet, and he got it done. And it was posthumously awarded, but still getting the highest honor. He was very proud to have served 37 years in uniform. He was very proud of being a veteran. He was very proud of being a Jew. And he was at all leadership positions in the Jewish War Veterans, the Military Order of World Wars, the American Legion. He was very much involved with the state veterans programs for Secretary Owings and Secretary Chow before that. So definitely going to miss Erwin, and I'm hoping his memories are a blessing to everybody that knew him. And that guy touched everybody. I mean, he would just stop strangers and say, "How's the disability?" And how do we increase your disability? He just was endless. In Yiddish, there's a term. It's called a mensch, and a mensch is a good guy. Somebody who does good things. He was the poster child of being a mensch, and so I'm going to miss him. You know, as Kenny says, I love Carroll County. I always say life is good, and I think it's a good partnership we do have up here. Wishing everybody a very happy Hanukkah that are celebrating. It's the end of the week. We do not have a session next week, as some of us will be going down to the Maryland Association of Counties. And then we'll have session the following week, and then we will not have session on the 28th in between the holidays.
The
So
14th and the 21st.
we have the 14th and 21st, we'll have open session. Last thing is, you know, even though it's a little bit far out, on our, mark your calendar, December 16th, which is a Saturday, is Wreaths Across America. And I believe all of us will be participating somewhere in Wreaths Across America. It's the first time the Springfield Cemetery up on Spout Hill in Sykesville and is authorized, and I believe there's 159 veterans interred up there. I will be participating there. The others will be in different places, whether it be in Hampstead, Westminster, all over. But mark your calendar. If you've done it before, you know the value in doing it. If you've never done it before, it's huge. And it's, it's just, it doesn't take a lot of time, but it makes you feel good in participating in something like this. So, okay. With that, what I need to do is I need a motion to recess and to go into the Board of Health.
So moved.
Second.
Any discussion? Seeing here none, all in favor?
Aye.
Okay. Now, Board of Health.
We're going to come up in rounds. Good morning.
Good morning, everybody.
Couple tissues.
Okay.
I'm just getting ready to cry. No.
Oh, no, don't do that. We don't have anything today that's going to make you cry.
Hopefully.
We'll see. So, let's see if I can do this right. So we're here today with our new Deputy Health Officer of Operations, Elizabeth Cianci.
Welcome.
And we're going
Nice to
to
meet
let
you.
her tell you a little bit about herself. So she's going to be talking, she's going to be working at the Health Department to assist with administrative and operational day-to-day duties throughout the Health Department with policies, standard operating procedures, those types of things.
Great, thank you. As Sue said, my name is Liz Cianci. Thank you for speaking about veterans. I'm a veteran myself. I'm a graduate of the United States Naval Academy and a former Navy surface warfare officer, so thank you for acknowledging the work that we do. That's much appreciated. I come from a operational and nursing background. I also am an attorney, not licensed in Maryland yet, but licensed in California and Nevada, and have worked in construction operations, hospital operations, and then obviously as a surface warfare officer. So most recently I was with MedStar as Director of Behavioral Health. Prior to that, I was Chief Operating Officer at Clifton T. Perkins Hospital Center with the Maryland Department of Health. I'm very excited to bring my operational and kind of day-to-day service operations and ground level operations experience to the health department.
She has hit the
Fantastic.
ground running.
Absolutely. Welcome.
Thank you. I'm excited to be here.
Any questions before we move on?
Nope.
All right, so I guess who's next? Your prevention, wellness, and recovery. On up.
All right, I guess I'm up.
On up.
If
Sorry.
you want to sit or stand, either way,
It's my first time, if you haven't noticed yet, so.
whatever you want to do.
We brought one of
All
our
right.
partners with us.
Okay.
All right, so forgive me if I say a lot of ums, and my delivery's a little shaky. I've never imagined I'd be speaking before you guys, but here I am, so thanks for having me this morning.
Thank you.
They only bite a little bit. so
Yeah.
No need to worry.
I'm Kevin McGinnis. I'm a Master Deputy with the Carroll County Sheriff's Office. I've been there 8 years. I'm currently assigned as resident deputy of New Windsor and Union Bridge. Additionally, I'm the community liaison and homeless outreach liaison for Carroll County. You're good. All right. So I attended a take-back event with the health department on October 30th at the Ag Center. During this event, I collected approximately 96 pounds of unused medications. This was by far the largest take-back event to date. Comparably, at the other two events, I normally collect around 20 pounds of unused medications. The difference between this event and the others was the addition of the Sharps disposal. A lot of individuals that dispose of Sharps additionally dispose of their medications. I believe that this is a real need in our county, and more events in the future would be beneficial to the community. Additionally, I wanted to touch on CIT training. I am a CIT officer. CIT stands for Crisis Intervention Team. As a CIT trained deputy, I believe it's extremely beneficial not only to the community, but the deputies and officers that are trained in CIT. This allows us to be more of a listener and a mediator when the scene is rendered safe. Now more than ever, individuals are plagued by complex mental health issues. Being CIT allows us to, in most cases, to have more of a conversation with the individual in need. This lowers the risk of potentially violent encounters. More times than not, individuals in crisis just want someone to listen to who genuinely seem to care and provide potential solutions. CIT offers this, and CIT additionally is comprised of a team of professionals in the referral process that provide continuous outreach to the individuals in crisis. So that's all I wanted to add.
The, go back to that slide, the last one. The Sharpies, or Sharps that you're calling them, are they typical insulin needles?
Insulin needles, yes, sir. Syringe-type needles, diabetic needles, anything of that realm.
Can insulin needles be thrown out in the regular garbage?
No, not recommended.
Okay, it's not recommended.
Not now.
However,
They can be put in detergent bottles, bleach bottles, and disposed of. But my understanding from the team, because we did a debriefing, was that people did not feel comfortable doing that, so they would just store them in their garage until an event came up such as this that they could take them
Sure.
to. So I think that's why we had so much at this event.
I just want to make sure I'm doing the right thing. My dog is diabetic, and
See?
unfortunately, we give him insulin twice a day, or else he'll pee all over the house, and we put him in a milk jug until it's full, and we tape it over and we throw it away.
And that's what we recommend at the
Okay.
homeless shelters and at some of the other facilities that have contacted us because they've asked us for Sharps containers, but if you use the Sharps containers, they need to be disposed of by a biohazard pickup, and that's
Right.
costly, so our recommendation is always that those
Right.
facilities use a detergent bottle or bleach bottle.
Yep. I do not throw my medicine down the toilet, but I do the
We're
pills
glad to
or the
You're
insulin
doing it
needles.
correctly.
So, okay, I just want to make sure that I'm not messing that up. Is this the collection at the Ag Center? Do you also have collection at the other senior centers?
Yes, sir, we do
Throughout
during
the
the
year?
bulk shred events.
Right.
We have a collection there. And normally, like I said, it's about an average of 20 pounds that we collect over,
Sure.
I believe it's a 3-hour period. This was also a 3-hour event, and it
Right.
was very inclement weather. It was cold, windy. There was actually an individual from Lithicum, I believe, that drove all the way up here to dispose of their Sharps. So there's definitely a real need for it, I
Yeah.
believe.
And the Senior Center, good morning, Commissioners. Amy Lagel, Prevention Supervisor. The Senior Center events do not offer the opportunity for Sharps, only the meds. But we are going to be making sure that there are events going forward. In addition, a lot of people have come forward who weren't able to attend the event and had the same questions. What can I do with my Sharps?
Right.
So we're going to be printing some magnets and putting them in all of the Dropbox locations that link back to the health department's website where it's explained how you can do this at home.
Right.
But as Sue said, what we discovered is that even if people knew they were able to do that, they just weren't comfortable.
Sure.
We had someone bring 10 years worth of Sharps
Wow.
that they had stored because they just weren't comfortable. So that's really good information for us, and we can work on, helping people, give people the information, the opportunity to regularly drop their Sharps,
Right.
but also to do it at home if they're comfortable doing that.
So on that note, I mean, why is there a way that we can help to facilitate the process where somebody who may not be comfortable with doing this, we can make that easier for them to do so?
Absolutely. We can do that in a couple of ways. One, just getting the information out there that right on the health department's website, it tells you how you can safely do this at home. But two, having regular opportunities twice a year where we can collect sharps from the community. So we're going to be working with Carroll County Government Solid Waste Operations to host 2 events a year. We'll partner with them. They're already doing it. And we also would like to work with them to be able to take back not only meds and sharps, but also vape and electronic cigarette devices that can have nicotine, which is a hazardous material. So e-liquids containing nicotine, we recommend that people store safely and dispose of properly. And that proper disposal means the battery and the e-liquid containing nicotine, which is why we're going to do it with solid waste operations.
But your first recommendation is not to use.
It is, sir.
Okay.
So I appreciate you highlighting the work of the CIT for this briefing and bringing the deputy with you. For people who aren't aware, the Sheriff's Department and the Health Department, but the Sheriff's Department in particular puts out a lot of information each month on what's going on within the county in terms of drug overdoses and things of that nature. And, you know, it's worth mentioning. I don't know what the leading cause of, I don't know what the leading cause of death in Carroll County is. I know it's not COVID. But we have had 32 fatalities so far this year from overdoses, compared to 40 last year. 274 so far this year overdoses, and then that's, again, 32 fatalities. So it's certainly, it's got to be it's the issue, right? And I know there are efforts to get into the schools as well, and Commissioner Rothstein mentioned the work of Tim Weber in the county attorney's office, but just nothing seems quite as important as that. So I appreciate the work you're doing, but
Alcohol is the most overlooked drug that we don't.
And
that
alcohol-
people do not focus on. It causes the most overdoses and poisonings that go to the emergency department.
Yeah.
It's about 1,000 people a year.
alcohol. I know, being a part of the opioid policy senior, the group, we've talked about obviously fentanyl a lot, but we've talked about how alcohol or even just tobacco in conjunction with these other drugs prove deadly or fatal or put people in the hospital. So again, just greatly appreciate the work that we're doing on this particular issue, because as far as I'm concerned, this is the issue that is confronting us as a county, and it's the one that's affecting our young people the most.
Sure.
So thank you.
And just to amplify that, just a quick second, is, again, yesterday in the session at Century High School, the state's attorney shared with those 11th graders, with the community, the, you start with alcohol and you have X amount of opportunity or chances of going into a much more dangerous drug. You have marijuana, it's even more of a chance to go into a dangerous drug like heroin. You start with cocaine, you have even more of a chance of going into a dangerous drug of heroin. And then vape is also a very serious, drug, based with nicotine. You have a serious chance of going into heroin, and that's not even talking about the fentanyl situation. That was the heroin, and then, oh, by the way, now we got this fentanyl crap that's out there that's killing entirely too many people. And we got to come up with ways to inject ourselves and our leaders and our parents. And, okay, how do we get to know this? And that's what I think the message was. And I see the sheriff back there as well, but I think that's what the message was yesterday. This is a community problem. So, yeah, anything, continue to resource and highlight the crisis intervention teams, I would appreciate. So
Absolutely. Thank you.
And just very briefly, if I may, just to take it back to prevention, to let you guys know what we're doing as well. We do also go into the schools and guest speak in the health classrooms. At the middle school, students receive this presentations that promote protective factors, setting healthy boundaries, using healthy coping skills instead of turning to something that could harm them now or later, and also future-oriented thinking. So getting them excited about and giving them the skills to plan towards their future very much protects them now against making problematic or risky decisions. Students in high school get a research-based science of addiction curriculum. So once they understand how addiction works in the brain and that it is a disease, we can also explain to them that all youth drug use is related. It doesn't matter what an adolescent starts with. If they start with anything, it exponentially increases their risk of using something else. So I appreciate that, Commissioner. Thank you.
And so can I ask, I mean, going off this, I know Commissioner Guerin and I know we've all spoken about this at length before, the increasing trend toward the normalization of marijuana use. How do we combat that? Because it is dangerous. It does end up leading to deadly consequences. How do we effectively push back against that? Because there's that mindset, that prevailing mindset in popular culture among young people, among older people at this point too, people who should know better, that this is a dangerous substance, but we're treating it like it's anything else.
I think one of the most effective things we can do is just simply tell the truth, which is that most Carroll County youth are not using marijuana. 80% of Carroll County high school students do not use marijuana. So we could also say that 20% do, but that actually feeds into inadvertently norming something that's unhealthy. So we want to make sure we do social media posts. We want to make sure that we inform the community that most students are not doing this. Most students are actually finding healthy ways of hanging out with friends and coping with challenges. We also do have a communications group at the health department around cannabis that's been meeting since April. We've sent a letter to providers informing them about the risks and harms of using marijuana cannabis during pregnancy. And we also now have a newly formed cannabis work group where partners come every other month and meet to sort of make sure that we're all on the same page with data that we may not be getting in formal reports, to understand the true impact of legalization in Carroll County, and to also be able to effectively plan and partner on communications.
Yeah, I don't know who it was. Yes, I don't know if it was Tim or who, but somebody said just that. Well, I just thought it was normal. I thought everybody's doing it, so I'm just going to do it as well as them. And then they realized, no, this was not normal, and not everybody was doing this, and there were other ways to, enjoy life besides, smoking pot or doing other garbage like. That's the other one was pharmaceuticals. Leading into heroin and fentanyl that was like the largest use, taking painkillers and stuff like that. So, but okay.
We're also struggling with a lot of the opioid settlement money that's coming out can only be used for opioid. For people who have abused opioids, which is ridiculous because that's not how addiction starts, and we need to be addressing addiction as addiction, whether it's alcohol, whether it's marijuana, or whether it's an opiate. It's, you have to be able, and I guess the attorneys involved with the opioid settlement money decided that they were going to restrict it to opioids only, and it just complicates when we move forward and we try to get this money out to providers. It complicates what they have to do. It's in order to be able to use the money, because they can only use it, and they'll go back and audit, and they'll make sure that those clients had an opioid diagnosis. And that's just simply not how everything works.
So I appreciate completely that 80% of our young people report not using it in this county, but 20% is still a staggering amount, though. And that's what I'm talking about. That's the thing that concerns me. When I was going through high school, I think it was like 10 or 12%, but this is 20%. That's a serious problem.
Yes.
So, yeah.
Yes, it is.
And part of that's addressing the parents also. So some of these children were raised in households where, now that it's been legalized, the parents used, and now they're allowing their children to use. So.
Right, and that creeping
I know
sense of
legislatively
normalization.
they're trying to make some changes to the laws they enacted last year. So we'll be watching that also.
Is there any way that we can work together to advocate or to promote changes in those laws?
Probably. I mean, we have to see what legislatively what they're doing, but I do know that one of the laws they were looking at was, I think they made it illegal to stop for the smell of marijuana in a car. And I think they were rethinking that law and trying to make some changes.
Well, if there's anything we can do to help you in that regard, please do let us know.
Well, we'll look and see what bills come out, and we'll make sure that, I know that you have a legislative person too that's going to be bringing all those to your attention. Because I watched that very carefully to make sure that we're weighing in on what we should be weighing in on.
Yeah, I don't think there's much of a distance between the fundamentals of our beliefs with the fundamentals of our legislative team that represent Carroll County. So that part, I think, is there. You know, it's convincing the other 85% of legislators that we need to do something. And I think we're chipping away at it on some issues. This may be a difficult one, you know, this year, but we'll see. So
I know other counties have done things like made it hard, set a distance for the dispensaries that they
Sure.
can't be near certain things and things
Right.
like that. So we can look at, you know, best practices from other counties also.
Even municipalities within our own county are looking at very stringent ordinances that I think are probably helpful.
And Commissioner Vigliotti, from a prevention perspective, we address every stage of life and every domain. So on the individual level, we do teach skills. We have a resilience program. We're able to support the Boys and Girls Club and actually supporting an elementary school to provide healthy opportunities for students to engage with other healthy peers. At the family level, as Sue said, we have parent programs that help parents understand research-based best practices for having these really difficult conversations with kids, and they are difficult. And then at the community level, we can all work together to look at what is the environment in which our adolescents and our children are growing up. And that's where I think some of those conversations could be really important.
Awesome. Well, thank you very much for that.
All right. Next up. Who's doing? Susan.
Thank you, Deputy.
Thank you, sir.
Good
Good
morning.
morning. I'm Susan Richardson. I'm the Director of System Development and Quality Improvement at the Carroll County Health Department. One of our units that we have at the Health Department is Service Coordination, and they work with community members, providers in the community, family members, really anyone, to help them identify and access behavioral health resources to help them with their recovery and wellness goals. And that would include mental health services, inpatient services, residential rehabilitation programs, outpatient psychiatric services, and substance abuse services such as inpatient rehabilitation programs, outpatient treatment, and medication-assisted treatment. We also help promote the information and crisis services, the 988 number, which is for accessing behavioral health services during a crisis. And we're available by phone, by email, and in person. People can drop by if the health department, if they are looking for help, and someone will be available to talk with them.
do we have any metrics on the 988 since
I
it's
do
been
not.
put in place?
Getting the 988 stuff.
Yes,
Yes.
yes. You mean new materials?
No, the
No, I
metrics on how many
apologize.
people are
Metrics
calling.
on,
Yes, we do have some.
what are they?
Have it with me.
Oh.
I can send it over to Roberta.
Yeah, I would appreciate just, you know, the value on, I mean, we're promoting it, we have cards, you know, about 988, and we continue to highlight it within, you know, I call the VA, you know, for medical issues, and the first thing they do is say, you know, 988 or 911 if emergency. If you feel, you know, thoughts of suicide, call 988. I'm just curious, is it working? I have no idea. And if
We
the
have
answer
those
is,
metrics.
if the answer is yes,
So-
then we got to have.
Part of our problem is not only are we a part of 988, but we're a part of the Greater Baltimore Integrated Crisis System, GBRICS. So Carroll County, Howard County, Baltimore County, and Baltimore City all have, so 988 goes to that crisis center to answer, so they have our statistics. So ours don't come from the state, they come from that partnership. So I'll get those for you.
Yeah, I think there's value there, because then we can say, yeah, this is working, and let's continue to resource it.
And I know there's a big push to the 211 push one, where all of those materials are to go away, so that people are sent to 988. They're diverting 211 right now to 988, and they want all those materials out. So we've been asked to, if we have billboards someplace, or if we have on your bottom of your email, if it still says 211, that they want us to promote just 988 now. Okay.
Thank you.
Are you here for this one?
Oh, the resource manual, yes. So we also worked in partnership with Partnership for Healthier Carroll County. Our service coordination unit worked very hard with them to identify resources for a manual, which is available in a book form and also online. So that is an online database of behavioral health resources and other resources like for food or transportation or housing or financial assistance.
Would it be possible to get us a couple of those physical copies? Because sometimes we have visitors or citizens who come in to talk to us about certain things. It'd be nice to be able to hand them something if...
Yep.
Certainly.
The most up-to-date is on the online version, because once they're printed, if a new provider comes in, they don't get added to it. So we always try to direct people. And it also helps for the hospital. So Carroll Hospital Center can go online and print out the page as they're discharging somebody and say, here's the resource that we're referring you to.
How about a flyer or something then that I could give somebody instead to say, okay,
Absolutely.
Sure.
thank you.
Does this also tie into the Circle of Caring? This book?
This book can be used by anybody, yes.
But I mean, is it,
It has-
does DCS or Citizen Services or DSS or CYSB, do they know that this book exists, and
Yes.
are
Oh,
they
yes.
using this book?
Yes. And it has information for housing, and because sometimes it's not just that people are having trouble locating or accessing behavioral health services because they don't know where they are or where to go. It's also that maybe they don't have transportation or they don't have, they need some financial assistance, people looking for, winter coats, people who don't have food. And all of those resources are in there, and also our service coordination unit can help people find those so that if there are barriers to accessing services, we can address that too. Thank you.
Yeah, actually, I do have one quick question. So just a quick use case, if you can indulge me. So let's say there's a young person at a high school, and they are in crisis. They feeling like they're in trouble. Or inversely, maybe there's somebody around them who feels that same way. So we're really talking about the same situation and the same first step of getting a hold of somebody. So what should that person do? What's the first thing? Is it 988? And maybe someone's coming up to discuss that briefly, but what is the simplest, easiest thing for that 10th grade student somewhere to do to get the ball rolling, to get help for themselves or their friend? Are we talking 988? Okay. There you. Yeah. See, I knew.
Sorry, I didn't wanna, like,
I knew when I asked that question, I was completely ruining somebody's briefing. But you never know, right? So.
Should I jump?
Yeah.
Good morning,
Yeah,
Commissioners.
good to see
Veronica
you.
Dietz,
All right.
Director of Crisis Services at the Health Department.
Morning.
That's a really great question, and yes, the answer is dialing 988. If they're in the school, obviously they're going to reach out to their staff at the school. The schools have crisis counselors and resources, on site. But if they're on their way home, or if they've gotten home, or they're in the community, 988 is a number that will get them access to not only a crisis team, if that's what they're needing, but also just resources. So we have the resource book that's specific to Carroll County. It's available online. But sometimes people don't know how to navigate that, or they don't have access, or that's going to take a little bit more effort. They can call 988 and get resources as well very quickly.
So 988 is a good catch-all,
Yeah.
if I could use that term.
It is a great one number for
Okay.
people.
Okay. Just want to get that out there.
Again, yesterday, during that 1 hour session, there was a slide that said, if you know somebody who is going through exactly what you said, reach out to a teacher, and it was like 4 or 5, I can't remember what they were, but, exactly that question. Because if you're in school, you want to get that person to the needed support, and a lot of times they're going to be reluctant, they're going to say, oh, no, I'm kidding, it was a fleeting moment or something, and don't allow that to be a fleeting moment type of thing, so.
The really nice thing, too, about the schools is that we have an amazing SRO program, and as of August of last year, we trained almost all SROs in CIT, which Deputy McGinnis was up talking about. So our SROs are a really great resource within the schools for behavioral health supports and resource, so.
Great. No, that's a great message as well. Thank you.
And then in addition to that, all of our schools, I think all of the middle and high schools have sources of strength. So all the middle and high schools have sources of strength. So they're trusted people within the school. They could be the cafeteria lady, they could be the janitor, they could be a teacher. They're not always a counselor or a teacher that people can go to because they've been identified as trusted people that kids go to anyway, and they have special training, and there are kids in each of the schools that are trained. You want to say anything else?
Oh, sure. So I'm here to talk a little bit about our CIT program. I feel like following Deputy McGinnis, who is a trained CIT officer, is really, he kind of said all that needs to be said from a law enforcement perspective. The vision at the health department is a safe and healthy community for all, and what we know is that there is a direct correlation between the health of any community and the public safety of that same community. And so the crisis intervention team program at the health department, the crisis intervention team program is a collaboration between local law enforcement, our community mental health, and community advocacy. And so we work alongside of 2 law enforcement coordinators to enhance and expand our crisis intervention team program. Started in 2014. We have had, I think, nearly 10 CIT classes. We're starting to increase the number of classes that we're offering each year. Westminster Police Department and the Carroll County Sheriff's Office have made the initiative that they'd like all of their officers to be trained in CIT. So we are working to help them achieve that goal. Currently, we hosted a class just in October where we trained 15 new law enforcement officers. 2 of those were correctional deputies. So we have nearly 100 trained CIT officers throughout the county in almost every municipality, Carroll Community College, McDaniel College, as well as several dispatchers. The real goal of the CIT program is to provide training that helps officers better know when to divert individuals from arrest or hospitalization, unnecessary use of an emergency department. What we're finding, and data is beginning to show, is that an individual who is in crisis, who is taken to the emergency department kind of unnecessarily, actually decreases that individual's likelihood to get help in the community after they're released from the hospital. And so it really is important for us to be identifying individuals that need resources and should be diverted away from a very lengthy emergency room stay, and just to some specific resources. So as you heard the deputy talk about, sometimes people just need someone to listen. We train the officers, they're extensively trained, but what we give them is additional information around behavioral health issues so that they can use the skills that they have and also this new knowledge to better support those individuals, to work to create a safety plan, and then to divert them toward additional resources that come to our office, and we work to support those community members beyond that. So we're excited that we will be hosting another training in April and again in October. And the goal really being to enhance and expand our crisis continuum. We see this as a portion of our crisis intervention, a crisis continuum for our community. So.
And forgive me if I missed this, the crisis intervention training is not just for the Sheriff's Department and Corrections, but also for municipal police forces? Okay.
And we have CIT trained officers in almost every municipal police agency in our county. There's only one that we don't have, but we're working to get there.
Awesome. Thank you.
Thank you. Thank you.
Thank you.
I do have other staff back at the health department, but you asked.
Somebody's answering the phone, so.
Yes.
Good morning. My name is Gina Palmieri. I'm one of the floater nurses at the health department.
Morning.
My name is Casey Bertizzi. I'm also one of the floater nurses. Gina and I both work in our communicable disease program.
Morning.
So we're going to provide a little bit of education today about what we're doing at the health department in terms of tuberculosis and rabies. Just an overview of some of the stuff that the communicable disease program does. We call it CD for short. We do infectious disease investigation and education, adult immunizations, refugee health, HIV testing and case management, tuberculosis treatment, and then rabies investigation and vaccine administration.
So tuberculosis is caused by a bacterium. There's a lot of misconception that it's an old disease or eradicated, but it's still very prevalent in the world, specifically in Africa, Eastern Europe, and Asia. It mostly affects the lungs, but can affect other parts of the body as well. When talking about TB, there is active disease and there is also latent infection where you've been exposed to the bacteria, but it's kind of dormant in your body and you're not sick and you're not contagious. Those particularly vulnerable to developing disease are children, people with weakened immune systems, and obviously people who have been recently infected with the bacteria. This little chart here is just some data of active TB cases we've had in Carroll County and latent cases over the last few years, and generally we get about 1 to 2 active cases per year in Carroll County. Our role is pretty vital. We are like the primary case manager for active cases, so we collaborate with their physician, our physician, Dr. Wack, and then also nurses and physicians at Maryland Department of Health. So if we have a suspected active case or a confirmed active case, we will draw their blood, we will collect sputum and send it to the lab. We do contact tracing, so any of their close contacts who have been exposed, we will test for them. And then also we do directly observed therapy. So any person with active tuberculosis, we actually have to observe them taking their medication every day. The first 2 weeks are usually in person, and then they are able to upload a video to a site called eMocha where we review the video and make sure that they took the medication for that day. Kind of what we do for prevention is, so we have a database where anybody who has a positive blood test, that comes to us and we just look into it further, make sure they had a chest x-ray, make sure that they don't have any symptoms. There is also treatment for latent TB. So if the client doesn't have health insurance, we do offer that at the health department for them.
All right, moving on to rabies, just a bit of an overview. Rabies is a deadly virus that attacks the brain and the spinal cord. It's typically spread through the bite of an infected animal. However, there is something called a non-bite exposure. This is when infected saliva from an animal enters the body through an open wound or in a person's eyes, mouth, or nose. And just to note, rabies is not spread by petting a rabid animal or coming in contact with their blood, feces, or urine. Of course, if you're ever concerned about a possible exposure in the community, just call the health department and we'll perform a risk assessment for you. In terms of data, this year we've had 69 rabies exposures. In 2022, most of the rabies exposures we had were from raccoons. So far, the data this year is matching up same sort of statistics. Raccoons tend to be the most. And then also to note, when testing an animal, the animal has to be deceased because we use the brain tissue to test. So what we do as a health department with rabies, we actually work with our environmental health program to conduct rabies investigations. Environmental health handles the animal aspect of things, so they're helping with the animal testing, the bite report, finding animals in the community, and they also offer a rabies vaccination clinic for pets throughout the year. The CD team is responsible for the person side, so if there's a rabies exposure, we're responsible for initiating the post-exposure prophylaxis, which we call PEP at the health department. This consists of 1 dose of RIG, which is rabies immunoglobulin, and then 4 vaccines. So that first dose of RIG can't be done at the health department, so we coordinate with Carroll Hospital. And then the hospital will also provide the first dose of the rabies vaccine. After that, we'll coordinate with the patient. Depending upon their insurance, they can come to the health department for the 3 remaining vaccines, or they can follow up at the hospital. And this is all done over a course of 2 weeks. We're regularly in communication with the hospital. If we have a rabies exposure come in, we're often calling the hospital just to give them a heads up that the person's coming in to start PEP. We also have an upcoming date in December for rabies education. We're going to actually be speaking with the ED providers and just going over what constitutes an exposure, because sometimes it isn't black and white. There can be some gray areas, so just providing some education. We also offer pre-exposure vaccines to clients who regularly work with animals. That includes the Humane Society, as well as vet techs and other persons working in a vet office. And then largely what we do is community education. I wanted to mention bats because we're noticing that there's been a rise in rabies in bats. And I don't think that people always know what to do if you have a bat in your house. So if you wake up with a bat in your room, you want to try to collect it as safely as possible. And then call animal control or the health department so we could get it tested for rabies. Always use window screens and chimney caps, and then seal holes in your house. That can help prevent bats from getting in. And then feral cats in the community. There's a large number of feral cat colonies, and I just want to make sure everyone knows that, don't approach them, don't feed them, because there also has been a rise in rabies in the feral cat colonies. And then, of course, just always make sure that your pet's vaccines are up to date, that you're never approaching or feeding wild animals, and then always leave your trash can lids. Make sure they're closed tightly.
Is there any idea why bats are on the rise for rabies? I'm just curious, because
Yeah.
So they're susceptible, they're mammals, and they are mixing it up with the other reservoirs out in the wild, foxes, raccoons, so it's just common exposures.
Gotcha.
All drinking from the same water sources and things like that.
Hanging out.
Hanging.
Yeah.
So you wake up in the middle of the night, you got a bat in your house, and you call who?
Call the health department.
Because, I don't know, maybe I need to call a priest at that point if there's a bat in the house.
Well, and the thing too with the bats, waking up with a bat in your room, bats are so small and their bites are so small that you truthfully might not know if it landed on you in the middle of the night. So that's why we say just, it's like,
Not terrifying in the least.
And it's truthfully, I put that out there because I've ran into a number of people who've had these encounters with bats and they had no idea that bats can carry rabies.
So I'm out in the backyard with my dogs in the summer, twilight, right? Bats are swoop. How worried do I have to be that a bat's going to swoop in and mess my hair up?
I would hope in that case that you would notice. But of course, if there's always questions, even if it be that we just had a case where someone found a bat in their dryer and wasn't sure what to do. We always say, just if you're in doubt, give us a call, and we go through a risk assessment, an algorithm, and to give you the best guidance.
Gotta go home and make sure my house is bat-proof.
Yes, yeah. Make sure all your openings in your home, make sure they're sealed because they're small and they can get through tight spaces.
And Ken, you and I don't have to worry about our hair. And
No.
just saying, so,
Thank you very much.
Oh, you're welcome.
Thank you.
Won't your dogs protect you?
Yeah.
They would, for sure.
They'd run behind you.
If they were tall enough.
They would run behind you. Actually, we had a bet between the shutter and the house, and that's where he was hanging out. So,
Oh, we have them all the
yeah.
time.
So I mean, we just got rid of the nest, and he was fine.
Oh, thank you.
Good morning, Commissioners. I just want to give you a quick update on a project that's new this year at the Health Department. One of my tasks is overseeing what we're calling a data governance initiative, where we're looking at all our data sources and our databases and standardizing data definitions, validating the quality of the data, and making sure that everybody knows how to analyze and report their data in ways that are most effective for good decision making. So back a few months ago, Ms. Wyndham contacted us about a question about some South Carroll septic systems. And so we pulled some data to answer those questions. And in the process of doing that, we realized that we have a lot of data about septic systems, but it's spread across 70 years and at least 4 different repositories of data, and some of those repositories overlap, and some of them are inconsistent. So they have some data in some not in others. So we have undertaken a fairly significant project to bring all those data sources together and standardize them so that the next time you have a question about septic systems in a particular area of the county or for the entire county, it's possible, it will be possible that we'll be able to do fairly detailed analysis on that data. And, as you look to undertake any future capital projects, this data and the analysis that we'll be able to do will be very valuable to you. That's it. Any questions?
Thank you.
All right. Oh, this is Maggie's.
Unless you wanted to.
Maggie's. No.
Hi, I'm Maggie Kuntz. I'm the health planner at the Carroll County Health Department, and happy to be here this morning. Before I start our wrap up, I just want to say that I have had my own bat encounter in our family, and I was very lucky to work at the health department because I did not know what to do when I found a bat in our children's bedroom, and several shots later, we learned a lot more about bats and bat proofing. So I just want to give you some few highlights. Dr. Wack talked about data, and I just wanted to mention a couple of data reports. Before we get to the report that I just handed out, a little more information. We just completed the draft of a secondary data report, and secondary data is data, are sort of county level data that's available across the state, so we can compare ourselves to other counties. And this isn't a formalized report yet. We're still working on a draft, but I just wanted to give you a few highlights. Interestingly, we have fewer primary care physicians and dentists per capita than in the rest of Maryland, but the number of mental health providers per capita is improving. So I'm excited about that because I know that's something we've been looking at and working on for a long time. I should mention, as you notice, the top causes of data in Carroll County in 2021. A lot of this data has been just due to the pandemic and also due to the security incident that happened at the state level at the health department. Some of this data is even more delayed than it typically is. So some of this is a little older. A lot of it is 2021 data that we're looking at right now. But the top causes of death in Carroll County in 2021 were heart diseases, cancers, COVID-19, and accidents. And we did note that drug and alcohol deaths are actually down from 72 in 2018, steadily sort of decreasing to 54 in 2022. That's preliminary number in 2022. We're watching some trends, including increasing syphilis, which is actually happening across the country, and is really a threat to babies of mothers who have untreated syphilis. And increased Lyme disease. So ticks people outdoors, that's great, but we're definitely keeping an eye on Lyme disease and other tick-borne
Lyme
illnesses.
disease in Carroll County is what
In
you're
Carroll
saying?
County. Mm-hmm.
Are you getting a lot of Bell's palsy associated with Lyme disease?
I don't know. I don't know as much about. We don't have data on sort of.
Okay.
We don't get the specifics of
Impacts.
how it
Impacts.
Yeah.
manifests. We just
Yeah,
say
you just say it's Lyme
Cases,
disease.
yeah. case numbers. And we're also seeing some other tick-borne illnesses as well.
Okay.
And then, as I said, we're waiting for the 2022 data on many of these things. So, next slide, just, so you now received copies of our annual report. Excited that we're kind of back on track with our regular reporting. Last year, we did a sort of a combined during COVID report, so this is a full year. So our budget, as you see, is about $23 million, and about 60% of that is grants, and 25% of those grants are competitive. Our collections, fees for service is about 5%, 5.5%. The state of Maryland gives us about 18% of our budget, and the county gives us about 17%. Thank you very much. We appreciate that. And some highlights. A lot of them have already been talked about, and I'm happy to see that some of them are highlighted right here on your podium there. The 988 that was introduced in July of 2022 and has definitely been a focus of our outreach in the last year. Our Keep Talking Carroll campaign is an in-house, sort of Carroll County campaign that has been expanding steadily across the year. It's really focusing on giving people the skills, parents, but also others, on the skills to talk to each other, to have conversations, some challenging conversations about some of the issues we were talking about today: mental health, substance use, other things we want to prevent by having good conversations and just teaching people about resources, but also having the skills to have conversations and normalizing that a lot with parents. We had a highlight some life-saving action by our staff. They teach it all the time, but they actually got a chance to use naloxone at a community program where they saved someone's life after an overdose. Our staff there, pictured there, Melanie Watson and Rebecca Rigney in our B-Power Bureau. We also completed a long COVID study. We worked with St. Mary's County and collected data from local individuals. You probably remember, we did a survey for many months to find, first we surveyed our known cases, and then we surveyed the whole community to find out, a lot of people who didn't maybe have maybe tested at home but had COVID, just to find out what symptoms might have started due to COVID and how long they've gone. We really found our results were very similar to the results across the country. People are seeing definite brain fog and neurological impacts, some heart and other health impacts that tends to hopefully dissipate over time, where there's less report of symptoms over time. So we've definitely seen our results are very similar to results across the country. And the other thing, I know the commissioners had mentioned some interest in some of our smaller programs and being able to highlight some of the many, smaller programs that we have at the health department. So we really tried to do that in this year's annual report. And one of the ones I wanted to highlight was our increased breast, cervical, and colorectal cancer screenings for low-income residents. A lot of screenings really took a hit during COVID, right? People were staying at home and weren't seeing the doctor as often. And so we've really rebounded. Our breast and cervical cancer screenings have actually rebounded. They're actually above where they were before COVID, and our colorectal cancer screenings are back up to where they were before COVID. So it's really happy to see that.
That's great to know. That last bullet. What about Stop the Bleed program that's been initiated by University of Maryland Medical and Shock Trauma? I know they're going around training teams across the state. I'm on the board, the visitor board, so we're doing public messaging and all that kind of fun stuff, but
We've all been trained at the health department.
Okay.
People that have been trained know where the kits are, and
so that's great. And just like I've shared, other times, getting us along with our team here trained, the more trained, the better we are.
We are. So our emergency management staff,
But I'm saying I'm not trained, and my colleagues, same thing with naloxone, same thing with Stop the Bleed. We have staff in the halls, and the more opportunities we have to train basic life-saving skills, the better we are. I mean, going back to being a soldier. Once I was a private, there were certain basic life-saving skills I was taught, and the more we have as a citizen, and not just somebody in the community, the better we are. So Stop the Bleed, naloxone, the basic life-saving skills. I would appreciate to find time and scheduling. It's
Your unit?
the right thing to do, so, okay.
Yes,
We'll make sure we send over what we train on, and if you want the opportunity to do it, we
Yeah,
can make sure
absolutely.
we provide the opportunity.
I know you've also worked on getting naloxone just to be more available across the community
Sure.
to make sure that it's.
I mean, it was handed out at Mako, naloxone. And, you know, and everybody can grab naloxone and have one or two and, you know, but if you're not trained in using it, I mean, you could do the best you can. However, you know, it's the same thing with AEDs. It's the same thing with, you know, whatever tools we have that are readily available to us, we should have the skill set to use them.
And the confidence, yeah.
And use those tools, so, okay.
That's a great suggestion. And lastly, I just wanted to say we have a lot of pictures in our annual report, just excited to be back out in the community. So here are a few pictures of us in various community events, some of which we, you know, partner with a lot of our community partners. And so we're just happy to be back out in the community, doing a lot of outreach and sharing a lot of information about our services and just about information across the county. So that's it.
One quick question, if I
Yes.
might. Jumping back for a second, on your secondary data report, you noted that on the county level, we've got fewer primary care physicians and dentists per capita than Maryland. Any specific factors that's causing that, number one? And two, is this something we're seeing on a downward trend historically, or is this a new change in things?
As long as I've been looking at the data, it's a pretty consistent trend. I think a lot of it has to do with just living in a more rural community where there are, you know, in larger cities, there are larger medical centers where there are a lot more providers per capita. So
Okay.
I think
It's
that's
also part of national trends for primary care everywhere.
Sure.
Not just rural communities, but across the entire country. Not as many residents are entering primary care residency programs.
Right.
It's a huge problem nationally.
Okay, thank you.
Any other questions?
That was it. I hope that met your expectations. You asked about our smaller programs. I know that you wanted some resources for behavioral health. So if you want more of that, next time we come back, we can highlight a couple of the programs. And it really brings the attention to the public of what we do and who to call.
So, Maggie, I appreciate all the work you've done from, you know, going through, you know, the epidemic, COVID, and getting the word out about immunizations and doing what's best and continuing the path. Now that COVID's gone, now what are the messages and the messaging that you want to highlight? And for us, you know, we're the megaphone for you, you know, along with others. So how you use that megaphone, you know, I think is important. And that's why I go back to the tools of the AED, naloxone, stop the bleed, and whatever else may be. You know, the 3, 4, 5 things regarding behavioral health. You know, what is the acronym that we want to focus on when we come across this situation? And again, you know, use us as a resource to do that. It's not the be-all, do-all, but it starts somewhere. I appreciate the briefing. Where are the biggest challenges that you have currently within the health department that, and I'm kind of shifting now, where we need to focus resources? Because if there's nothing, then you're sitting perfect, and I don't believe that's the case. So what are the issues? I mean, is it environmental health? Is it, you know, where are the warts?
It's a little bit of everywhere. It's
Okay.
just getting back to normal, trying to get the staffing that we need, trying to figure out where the gaps and barriers are now versus 3 or 4 years ago, what's changed. So we're getting a little bit, I don't know if they want to chime in. Dr. Wack, you want to chime in on anything we're currently struggling with? Just the data project is a good example of it, where we have data in 7 different areas, and some of it's on microfiche, and how do we get that put together so that when somebody asks a question, we're not 2 weeks giving you an answer. We're able to search that data and find the answers to that.
Do we have the ability in environmental health and the septic systems, when somebody wants and needs permitting to do whatever may be, it's not as nearly an issue in my area, in Eldersburg, but it is an issue in elsewhere. And what's interesting is Commissioner Kyler and I have had this conversation, and I probably could have the same with, Commissioner Vigliotti and Guerin, in the same sense that we don't get the calls I don't get the calls because it's not the issue in Eldersburg and Sykesville. But it is an issue in Finksburg and other places, and Woodbine, I would imagine, and other places where there's not that public water. And it's frustrating. So he's telling me how frustrating it is when somebody's calling and it's been 2, 3, 4 weeks and they're, getting the goalposts moved here or there, and they're spending a lot of money of their own. And I'm kind of like a deer in the headlights because I don't understand that issue. We gotta figure it out.
Permitting of new septic systems, is that
So that's
the
one
issue?
of them, yeah.
Okay.
Yeah.
So that's a workflow issue that we're always working to improve, and there's definitely opportunities for improvement. It is connected to the data piece of it, although that's on the back end. Health Department-wide, we've got relatively new leadership, and now with Ms. Cianci, we've got some additional resources to start really digging in post-pandemic into the sort of updating and optimizing and reorganizing of pretty much the entire health department. I mean, there's some areas that are more in need of it than others, but there's things that really need to be brought up to speed that have been neglected over the past, 5, 10 years in some instances.
Like what?
Internal workflows. Who's reporting to who? Who's responsible for what program? How is inventory ordered and managed? From very basic things to big things.
And environmental health remains the area that's understaffed. They're not understaffed as much as we were a year ago, but we're still, I believe there's 3 vacancies there. One of them is in a supervisor position. Our workforce for, now they're all fully licensed now, but that's recent. So our workforce was mostly trainees for the last 2 years. So these were people who were on the job, learning their job before they could take their licensure test, before they could, they were working under somebody else's license. Everything had to be checked, and that's all just recently changed from August, September, October. So I believe we only have, I'm going to say 1 trainee left, but 3? I'm wrong. Felt like we had so many, and they all got licensed, but I guess we have 3 left. So they are all still working under other people's licenses. That work still gets checked, double-checked. If there's issues that you're experiencing, I would say reach out to me, and we'll dig into it and figure out why the work is. I know we had a couple of challenges, especially down in the Finksburg area, with a project that went forward where the well was not identified. With a gas station, and I know that was a challenge, and it had a stop work order, but we were able to find a solution with MDE that was agreeable to get that taken care of. And some of, we've been through the challenges with, when a restaurant's on well and septic, that's a way different challenge, because generally we don't decide the seating, the fire marshal decides the seating. If they're on well and septic, the sizing of the septic system determines the seating. And, we now put that on the licenses, that it's public or it's this amount of seating based on well and septic. And some of the areas in Finksburg, particularly, because I'm thinking of 2 off the top 3, off the top of my head, that are down there are on well and septic. And they're on well and septic where there's 6 businesses and 3 apartments, and so what we can allow there is carry out. And those are things, and we try to encourage when there's a sale of a property that people have a septic inspection instead of finding out afterwards. They actually not just ask for the septic inspections, but have a septic inspection yourself when you're buying a business or leasing the space for the business, so that you're aware that when you put your application in for 40 seats, we're going to say you can have 4, because that's what you're allowed on that. So.
And that's it's not a huge problem, but it's definitely a problem that
Yeah.
pops up
Yeah.
again and again, is legacy systems that are on properties that were permitted 40 years ago.
Right.
The property has changed hands multiple times over the
Right.
years. Property may have changed use over the years, and yet if they don't have a renovation to the system, it's not visible to us as the holder of those permits until there's a problem, or until somebody brings it to our attention because of, of financing or something. Somebody's asking a question during a real estate transaction about that septic system. So one that we have encountered several times is residential properties that are going through a transaction, and it's being marketed as so many bedrooms because of renovations that have occurred over the years, but the septic system is the original septic system.
Right.
And somebody calls attention to it, and then it comes to our attention, and then we have to say, sorry, that system is sized for 3 bedrooms. You can't market that property as a 5-bedroom house. And creates a problem. I'm sure somebody will hear about that,
Yeah.
because, there's the health department again being unreasonable, but
And we're further challenged when that property happens to be in the wetlands, and we can only wetland perk, and we can only do that from February to May. So if we discover a problem in July, they're waiting till February. If they've put a driveway over top of their alternate septic area, which now has made it non-usable.
Right.
So there are multiple levels of challenges that, and I get the calls.
Yeah.
And usually when they get to me, I sit down and I try to explain everything, and I show
Right.
what it is they have to do and why it is they have to do that, and, and that type of thing. So, I don't
Yeah.
envy the problem, because it's like, it's a problem.
It
and
sounds
it's
like
challenging.
every problem or issue is an individual problem and issue that has to be held one at a time.
But to your point, Commissioner, or I think the original point about the
And I'm just
turnaround.
pointing to him, but I think it's across the board.
Yeah, so there's definitely a customer service component to this.
Right.
Somebody asks a question or a situation arises, you want to get an answer, and you want to get it in a timely manner. So certainly there's a communication component to that, communication internally to us, but communication between us and the public. That's absolutely part of it. That can always be better. A part of it is the complexity of these things, that it just takes time to sort out the details and run all the complexities to ground. But then there's also the data piece of it, is that if we don't know, if we can't find that original permit because it's squirreled away in some microfiche somewhere from 1955, it takes time to find that. And so that's another impetus for bringing all that data forward, consolidating it in a common database, so it's a couple keystrokes away.
That makes sense.
And then we pull a piece of paper and there's a pencil mark on it that says that's the septic. And we're like, what is that? Because it's from the 1950s, and that's all they did back then, was this piece of paper with a pencil mark on it. And we're like, okay, so then we have to go out and really do a
Survey.
little bit more investigation. And you can have 2 pieces of property side by side, because we just did this in New Windsor.
Right.
And one's 1/3 of an acre and one's 3.5 acres. So one gets their well right away, and the other one's waiting because they can't get far enough away from septic or far enough away from a property line. And we have to get a deviation or a variance or something to say, okay, we need 100 feet, but we only have 50 feet. Can we do it?
Are there best practices elsewhere that we can either take a look at or resource
So
in
all of
order to
this
accomplish?
is actually going on at a statewide level. There's a group that's
That's
been
kinda
meeting to, no, I've actually seen the policies. They don't say that they don't have formal headings on them, but I've actually seen the paperwork. And they've been working on some standard operating procedures and some more guidance, so that there's not just COMAR that, we're then taking and using our best judgment and then working with MDE or MDH to figure out which way we're going. There's actually some policies that have been stood up, and we've been asked to give feedback on them, and that was just last week, I want to say. So I feel like we're moving in a direction where we're getting some more, where it's not, we're waiting on MDE, who was just as understaffed as we were. They had 37 openings statewide. So
Right.
they have workers who are actually doing the job at local health departments because the local health departments are so understaffed that they're going to Wacomico, or they're going to Cecil County,
Right.
or they're going to the Eastern Shore for 2 weeks and working. So we're without that guidance for those 2 weeks, where we need a decision, but we're in a holding pattern. And, part of that is maybe that we need to communicate better that we're in a holding pattern because MDE's not available to give us the next steps.
And I think-
What are your thoughts?
Well, I was going to say, I think there's special situations with commercial versus private and all that. The perception, I think, and I think it was, we have it on our side of the fence too. The public feels like they can't talk to people. And I know I was surprised. I took in 3 perk tests and I said, "Hi, I'd like to talk to somebody about perk test application." You'll hear from them. And I thought, man. So I called my engineer and said, find out what the heck is going on. And, I don't want to wait forever for this. And I just heard from a well driller last week, and we hear the same stuff. And it's some's perception, some's reality. In Howard County and Baltimore County and whatever, I can see a person. It's like I go into Carroll County and it's drop off the paperwork, we'll give you a call. And some of that's hangovers from COVID times, and we're slow recovering. I know, and I talked to you, and you were very helpful in another county at a rehab facility. Everything was, we value family interaction. So I called, and they said, you're not allowed to visit. So I thought, well, you change your website, and if you don't want family there, that's okay. And that was that county's issue, and somebody from the state did call me, and they're working on it. But, it's we all deal with the public, and perception can be reality. And you said communication, it's how they perceive it. And the other thing, I think you guys and us, we're 90% complaint driven. We don't go out and seek out stuff. It's when a complaint comes in, and that complicates it. But
So
I think it's
Absolutely.
incident you described, Commissioner Carl, that's a straight up customer service thing, and we can certainly do better on that.
we all can.
Yep.
And I think also, you alluded to this a little while ago about sometimes you have to wait for the state, discussions with them about which way to proceed. So for me, areas where we can exercise greater discretion and flexibility in dealing with our citizens in this county. And anytime you run into a problem with the state where they're giving you a hard time or whatever the case is, let us know, because we're happy to have your back to say, look, our health department wants to do X, you're not letting them, right? For whatever weight we carry, we're happy to have your back. Because again, it's all about exercising discretion on behalf of our citizens as safely as possible, but also that, as everybody was referring to, that sense of perception where, if I go to the health department for whatever reason, I expect some kind of answer. Even if I don't get the specific answer I want right away, hearing from someone that, we're working on this, or we're waiting for Department X at the state to get back to us, just knowing that something's in process, I think is going to go a long way as well.
So that's a great point, but it's also important to note that the desire for best practices and standardization of procedures is in necessarily tension with the ability to customize solutions on a local level. Those two things are in conflict. So to the extent that we have best practices and standardized procedures, that decreases our ability to exercise discretion and create custom solutions at a local level. And that's part of the friction or the dialogue that's going on between local health departments, MDE, other constituencies about what's that balance? Right. How much can be standardized and dictated centrally versus what needs to be left at the local level for that discretion? And it's not often clear, and it's often a moving target. So that is another layer of complexity on these things.
Andrea Hanley is here too, and I sit on an ag tourism work group. We've been sitting on it for I want to say 6 or 7 months now. And it has MDE, MDH, local health departments, MACO, Grow and Fortify, and the Department of Ag are all sitting on this. And we've done circles around what is really needed, because there's a definition of ag tourism that doesn't include everything it needs to include, and people throw anything in it. And basically, we've gone round and round, and do we need to define what ag tourism is, so that we don't have to sit here, so that, Charles County is doing this and saying it's okay, and Carroll County is doing this and saying it's okay, and somebody else is not allowing any of that. Do we need a definition of, because apparently glamping is ag tourism. I don't even understand it. And people, think because they bought a farm and, they want to do a brewery and they do it there, or they want to do an ice cream stand and they do it there and it's part of their farm business, that's ag tourism. And then you get people who have 5 alpacas on a farm and then to put a paintball arena in. And how is that ag tourism? So we're looking at it and going, well, do we need to define it? But in addition to that, I've learned a lot about Grow and Fortify, who is a resource for people who want to go into businesses like that, who can walk them through coming to the county to determine what they can do, what they can't do, checking out zoning, then coming to the health department to talk about. And one of the things that came up was, well, we should really encourage people to think through where they want to grow their business. And we're like, we do that all the time. We ask people, where do you, are you sure this is all you want to do? Because many of these businesses start out as a brewery or a winery with food trucks. And they're not going to do food. They're not interested in doing food. They want food trucks. And then they find out that the food trucks aren't reliable. And then it's like, okay, now we're going to do food. But they've made decisions based on not doing food. So then there's new stuff that has to be done. So I think there's 17 pages of frequently asked questions that we're trying to put together so that people have answers and people have resources before they get to those parts where they're stuck because they've made decisions that were not in the best interest of moving forward because they didn't know what was going to happen. But and we were like, do you really think we don't tell people to, like, what would you want to do in the future? Right. If you plan now, then you can use your land properly and resource it properly.
It comes down to, like you said, communications, expectation management. Start with yes and figure out how to get there, not start with yes and just allow it, but saying, okay, we're going to work together to get you to where you want to be. Here are the steps necessary to get there. And oh, by the way, if you don't comply on these, the answer is no, or we have to do certain things. But again, that's
an old saying in behavioral health that expectations are resentments waiting to happen.
Yeah.
That if you don't communicate what you expect, I can't mind read. And if you tell me what you're expecting, then we can have that communication and I can guide that.
Absolutely.
And any of our team can do that as long as we know what the expectation is.
It's the same thing. If you're at the table, speak up, because once you walk away, I should have, too late. That's why we're at the table. So, okay, is there any other conversation, discussion? I really appreciate the candidness, especially at the end, having this ability to talk through some thoughts and ideas. And I know, as always, it doesn't stop here, in adjourning the Board of Health, as we are one team working to get a better Carroll County and continue.
Can you quickly introduce some staff that didn't get to come up front but is here?
I'd like to all stand. I'll try to do my best.
So those that didn't come up front.
It's probably
stand.
half the room, I know, but.
Tierney Youngling is our Director of Nursing. Marie Liddick is the Deputy Director of the LBHA. Kathy Baker's the Director at the LBHA. Andrea Hanley is the Director of Environmental Health. Lisa Staley is the Assistant Director of Behavioral Health. Lily Riebert is our CD Supervisor, I believe. And Lisa Rock is the CD Nurse Manager.
Okay.
And Commissioner Rothstein, I'd be remiss if I didn't clarify that COVID is still very much here. Sorry. It's not gone.
I understand.
Okay.
And it's something we're going to have to continue to deal with.
Yep.
It's a virus that's there, and don't know when it's ever going to go away, but that's
It won't,
regardless. So,
It's
okay.
here.
And it's hard because so much credibility was lost, especially towards the end. And I'm not saying by local people, but we were lied to. Then it was never mind, and then we wonder why we don't trust anybody anymore. That's a big part of the fight is credibility, because many, of course, I was on the school side of it then, and
That's a much broader discussion than we have time for here.
yes, but now we're looking at learning loss and all the things that happened from it because we let it happen.
Communications.
We need to make sure
Our
we
big mantra
communicate.
going forward is make sure you're getting your information from credible sources.
Right.
That you're not looking at
Role of
Facebook and
disinformation.
Instagram and
And
people that
politics,
are, just because it's
unfortunately.
out there doesn't mean it's true.
Yep,
Yeah.
yep.
So, no, so,
Oopsie.
yeah, okay, we went there. I think what people in the medical community have to understand, and if they don't, they're going to fail, is that when you start talking about COVID, you may be talking about something medical. But to people like me who had 3 kids at home who weren't learning, you had people who lost their jobs, I can keep going and going and going.
Sure.
You have to understand that you may say one thing, but what people hear is something completely different, and they're both right.
Well, so that's the role
So
of disinformation.
that is
So
that
that's
I wouldn't call it, that is not misinformation.
disinformation.
No, that's not disinformation either. That's just what happened. So you've got to be aware of that. So I mean, I don't know if we want to veer into this discussion right now. It could go on forever, but you got
'Cause we'll never leave.
you've got to understand what that means
Sure.
to average working class Americans who went through COVID, because we all went through it. And the worst part of being up here sometimes is people trying to lecture me on what happened. I was here too. So I just think that's what you've got to be careful of. I think that's what Commissioner Kyler was sort of alluding to, is that there's the medical terms, there's the virus, there's the shot. It's all still
Dead
there.
bodies. Let's not forget the dead bodies.
Yeah, okay, well, I mean, again, we can talk about that some other time as well, because I started out this discussion talking about, I think, 40 plus people killed, in overdoses this year in the county. I think that's pretty important too. I think I might be off on that number, but the point being, you've got to understand that when you start talking about COVID, it might mean something to people in one place, but to a majority of Americans, it means something else. And they might be both right. So
to me, COVID's a virus, and it's there. I was sick twice with it. I was out of work because of it. I was isolated because of it. My father died because of it. My father didn't get treatment because of it, because the hospitals were so impacted on the floors that he was in the emergency room and could not get the treatment. And anybody knows you don't get healed in the emergency room until he finally got into a room. So, no, COVID is a virus, and it was very deadly, and it's very unfortunate, the impact that it did have. But it is a virus. Everything else above and beyond that, we can have conversations all day long, but that's how it affected me personally. And, I think the only saving grace is that the federal government gave me money to bury my father because he passed on COVID. And that's pretty sad to think. So, yes, COVID is real, and it's still affecting our hospitals, and fortunately, it's not going to have the same impact it had a couple years ago, where people were dying.
That's correct.
So,
I
in such
apologize for
large-
opening that can of
No,
worms.
I appreciate it. It's important. Well, it's important to recognize that, we deal with a lot of things and you do too, from environmental health through having these hard conversations, through, having these reports that share the impact of things that are happening, whether it be TB or rabies or, whatever it may be. I mean, your plates are full and so are ours. And the best thing we can do is share to the community the best information we have at any given time. And that's it. I mean, there's nothing to me political about this.
You're going to see COVID on our annual reports,
of course,
for the foreseeable future.
I would expect
so.
so.
I didn't want anybody to think that, why are they still talking about COVID?
My sister's a pediatrician, and she dealt with it every day, and the numbers were going up.
But
so.
again, back to customer service and everything. we need to learn from the science.
Exactly.
We were hit with that with very little knowledge, and everybody was learning at the same time. Now we have some science that's proven certain things weren't so effective, and plus, and I don't care if it's the ODs, the bats, even the dogs. We need to be conscious of all of it, but we also need to be conscious that every citizen in Carroll County deserves their constitutional rights and their choice too. And that's hard, and thanks for bringing it up.
No, absolutely.
We all got to talk about it.
No, I mean, seriously, you know, we don't want to be Chicken Little, but we don't want to put our, you know, head in the sand. And there's a balance between putting our head in the sand and saying it doesn't exist to being Chicken Little saying the world's coming to an end. The world did not come to an end, and we worked hard not to put our head in the sand.
And unfortunately, we talked a bunch about marijuana, another tough subject. In reality, 55% of Carroll Countyans that voted said they wanted it. Now, does that make it right? Not sure, but we have to deal with that.
Right.
You know?
Okay.
Thank you very much.
Thank you.
I apologize. Any other? No, you're still on the hook until we adjourn.
Thanks for introducing everybody.
You're still on the hook until we adjourn, so you never know what the hook may be. Are there any other conversations? Because this is our show, not yours. Any other conversations, discussion from us? At this point, I do need a motion to adjourn the Board of Health and reconvene our open session.
So moved.
Second.
Any further discussion? Seeing here none, all in favor?
Aye.
Now you can go
Thank
away.
you, guys.
We'll give it 30 seconds to a minute, let people run away as necessary, and we're going to go to item 2.
We got a lot of.
You don't think we can just go to item 5?
We should have a public hearing, yeah.
Can we do
I was
that?
going to ask that.
Why don't we just
Let's move
go
that
right
up.
to item 5? Is there a reason?
Oh, it's Jim.
The health department, people
We're
are
here
here for item
waiting.
2.
Oh.
So you have item 2 is the health department people and
Okay,
our staff.
okay.
Item 3 and 4 is the sheriff.
Maybe we can just be expeditious.
Judicious, yes.
But I
So that's
Okay.
what,
I appreciate the
I tried.
question.
yeah. I mean,
No, I texted to her about an hour ago. Okay, let's move on. Item 2 is a grant approval to submit application acceptance of award for the Community Coordinated Supports Partnership grants to Hub Pilots. Mr. Singer, you are no longer wet behind the ears. I'm glad to see that. Ms. Steckel, talk us through this.
Good morning, Commissioners.
Morning.
As Commissioner Rothstein said, we're here for approval to submit our grant application and acceptance of award for the Community Coordinated Supports Partnership, grants to Hub Pilots, and approval to hire recommended staff contingent on the grant award. I know you've all heard us talk a lot about the hub and spoke model regarding behavioral health services within the county. Earlier this year, the State of Maryland Community Health Resource Commission did a call for proposals for grants to spokes. That process is still working through. They haven't made the awards to the spokes. The spokes will provide behavioral health and related services and supports to students and their families. In October, the Maryland Community Health Resource Commission also issued an additional call for proposals for the hubs. The role of the hub is really to coordinate service providers, which are the spokes, do the monitoring of their programs, and award the grants to spokes, and also collect report on data related to the services. This whole application requires extreme collaboration throughout the county by all the partners that are essential in this process. This is not something we can do by ourselves. I do want to introduce, we have folks at our table today representing Carroll County Public Schools. We have Carl Streeker. He is the Director of Student Services with Carroll County Public Schools. You know Ed Singer is our Local Management Board Manager. We also have Kathy Baker with us, the Local Behavioral Health Authority Director with Carroll County Health Department. We also have Sue Doyle is with us as part of this as well, the Health Officer, and then Cynthia McCabe, who is the Superintendent of Schools for Carroll County Public Schools. So I'm going to turn it over to Ed to walk through what we have created as our application strategy, and how we're going to partner with the local behavioral health authority, and where the school system pulls in with
Okay.
this application as well.
Okay, thanks.
So we all got together and met on this, but I guess let's take a step back to when the spoke applications were due. The school system was essentially receiving applications for these providers to provide services here in Carroll County. We all got together with the school system, local management board, citizen services, the health department, and our LBHA to collaborate to figure out what we really needed here in Carroll County, and came up with some ideas. And we essentially acted as a hub without having a hub in place. So we again got together when this proposal came out and said who would be best able to meet the requirements of being a hub for Carroll County. And in our discussions, we decided we already have the local management board that's in place that has all the key players who could act as the governance for this for this proposal that we're looking at to manage these providers. It's actually a very similar function that we serve now in overseeing grants that are sub-granted to providers. And the referrals that we're receiving, some of the more complex cases come through our local care team, which includes a whole bunch of the partners already. And we felt like all those pieces were already in place, and it made sense to build upon that rather than try to reinvent the wheel. The local health department's going to partner with us by providing oversight of the programming from the providers, because they have the expertise in that area, and there's funding in this for them. We'll have a program manager that will essentially do the same type of thing that we're doing with programs that we have through Social Services, Department of Juvenile Justice, and through the Governor's Office on Children, Crime Prevention,
Youth and Victim Services.
Youth and Victim Services that we have grants through already. So it's a very similar process. The big part of this that I guess that I want to express to you all is we want to be able to make these decisions here locally. These hubs the spokes are going to exist, these services are going to exist, and they'll either be managed by us if we're able to be the hub pilot, or they'll be managed by somebody else, and they'll make the decision on what services we get here in Carroll County. So it only makes sense to us that we be able to collaborate with our community partners and be able to make the decisions as to what's right for us here in Carroll County, and to be able to manage those resources here locally. So there's, you all have a budget in front of you, but essentially it would be some of my time. We would have a program coordinator. Our LCT coordinator right now manages a lot of the referrals that we get in the current programs, and they'd be doing some of that. And then, of course, there's a fiscal piece that we have to have support of our fiscal department to manage, and the LBHA will provide the oversight of the programming. I don't want to take up any unnecessary time, so I think that kind of describes it in a nutshell, and we'd be glad to answer any questions that you would have of us.
So
I'm curious. So, and you described it, and I think it's very smart using what we, so many things. We find out Carroll County was already doing a good job, so follow up. But I guess my question is, with the 17 months and the $350,000, what happens July 1st of 2025?
So I guess, do you want to address that, or you want me to, Celine?
I can. And so the idea for this is to go on as a kind of a 10-year project. And so we will reassess year after year. If the funding were not to come in, the services would stop and wouldn't be provided, so we wouldn't need a hub to manage that oversight. So we would have to reevaluate. But the intent of this is to keep
it going.
Keep it going.
With grants.
And that was going to be my question, because you talk about needing a new full-time program coordinator and also potentially a part-time fiscal specialist. And so my question was straight to what Kenny was saying. Is this an ongoing grant that we know is going to be offered year after year?
Right. That is the intent of the funding. And again, with all of our positions that are grant funded, we always add that clause that if the funding were to go away, there's potential for the position to not be there. But we believe this is going to be a strong service that's provided. We know there's an extreme need in our county for additional behavioral health supports for families, children, and youth. And so we will continue, we'll continue to rally. The other piece will be to look at other sustainable funding for this outside of that. So, you know, we will continue to do that and work with the LBHA as well.
So, just pulling that thread out just a little bit more, because I agree. This is a great opportunity. It is a competitive grant.
Yes.
Looking for other funding, are you talking about other grant opportunities or turning back to us and say, we want to now fill these positions?
Good question. No,
Well, thank you.
that would not be the intent, to turn back to the county to ask for that, but to work with the health department, with the consortium, looking at other grant options, but also seeing if there were services that are reimbursable, that the cost could be sustained in another way.
But 17% of the health department's funding is us, and this could be added to that, which, you know, it's again one of those things, and we just always recognize grants are wonderful, you know, opportunities to kickstart something. But if those grants go away, you know, then who's left holding the bag? It is the county. If the, you know, project or program or whatever we may want, initiative, pilot, is working. And we don't want to have that go away, but that's, you know, funding. So, no, I think it's good. It is competitive. The dollar amount is associated with the needs of these positions. Is that correct?
Correct. We can apply for anywhere between $300,000 and $500,000.
Okay.
And when we worked out our budget,
Right.
and based on the size of our
Yep.
county as well, this was what we identified as our need to provide the oversight of
Yep.
this. I do want to say that 10 hubs, hub pilots will be awarded through this call for proposals. There is intention that they may be able to fund additional hubs in the future. We feel that our application is very strong because we are partnering with the local behavioral health authority, and you can apply. Only 2 agencies were permitted to apply for this hub, and that's the local local management board or the local behavioral health authority in a jurisdiction. So no other agencies are available to apply for this. We are partnering together in this application, and we believe that makes our application even stronger as that type of a model.
Okay.
Would I'm sorry.
No, go ahead.
I was gonna say, would a letter or something from us help in the process? Add any weight to it?
I mean, it certainly couldn't hurt. We've gotten letters of support from the Department of Social Services. The hospitals agreed to give us a letter of support, the school system, the LBHA, the health department. Well, I think we've got a total of 8 letters of support out there, and certainly a letter from the commissioners, and we could put something together for you supporting us in our application. Certainly couldn't hurt to
Sure,
put
thank
into
you.
the packet.
Yeah, thank you.
Hi, this is Kathy. I just wanted to share, too, that the behavioral health providers that applied to be spokes were already pre-existing providers in the community. Not anybody new, not
Right.
anybody that's going to come in from the out-of-state or anything like that. So they're pre-existing providers that the schools has worked
Right.
with.
And I'll add to that. I think one of the important things that Ed was speaking to, we basically created our own hub model at the outset because we recognize the importance of knowing the folks that are working with our students, and want to leverage the relationships we have and be able to maximize that for our kids. So basically, what we got requests from folks all over the United States, not necessarily even the state of Maryland, that they were going to provide services. And part of their application process as a spoke requires a letter of support from the school system. We only provided letters of support for those agencies with which we already had a relationship, either ourselves as a school system or with our partners in behavioral health as a whole, which basically said no to hundreds would be an exaggeration, but definitely more between 50 and 100 emails. We'd like to do this, we'd like to do this, and we just don't think that that's the best option for us in Carroll County. I really wanted to highlight those folks and not have them competing with outside agencies. So we're hopeful that those will be awarded through that, and think that this hub model, being local, would be very much beneficial to our community.
Yeah, I agree. The relationship with CCYSB on this, is there one?
We don't have the
There's
list.
no spoke?
We can't share the applicant who applied, since they weren't awarded yet. We can't share that information because it's in a formal procurement process.
Are you like doing a foot stomp? No, I'm kidding. Okay. Okay.
Motion to approve the Hub Pilot Grant application submission and acceptance of the award and to hire recommended staff contingent on the award of the grant to the LMB.
Second.
I have a motion and a second on a very lengthy motion. Any further discussion? Seeing here none, all in favor?
Aye.
Great job and
Thank you.
great collaboration up front.
Have a good day.
And thank you, Dr. McCabe,
Yes.
for all you're doing. Okay, let's talk about psychological services. And I believe we have the sheriff coming on up.
And I think worth mentioning, there's a number of people here who are here to do public comment. Each individual item has public comment, so if you're here for an item that pops up, please let us know. Otherwise, it's when your item comes up. Correct?
That's absolutely correct, and just bear with me. Chris, is there anyone on the line? Chris?
Yes, sir, there is not.
Okay, thank you very much. And just up front, Sheriff, personally, I thought it was an awesome event yesterday. So I appreciate the invitation from Tim and also seeing you and the team there.
Very appropriate, yeah.
Yeah.
Good morning,
powerful.
everybody.
And anybody that gets a chance to go to one of those,
Yeah.
it's
I
definitely.
know they're
worth
doing Liberty Next and,
And like you said, the auditorium wasn't full to capacity,
Right.
but fairly full with high school juniors
Yeah.
who sat there and listened and paid. It was awesome.
yeah,
That
you,
one in my area coming up in January that I'm going to go to.
you could hear a pin drop, the focus. So, okay, let's talk about this contract award.
Good morning.
Morning.
The Office of Procurement, in coordination with the Carroll County Sheriff's Office, is requesting approval to award a contract for psychological services specializing in law enforcement to Kimberly A. Miller and Associates in the amount of $45,000. Kimberly A. Miller and Associates has been developing mental health and wellness support strategies for multiple years for the Carroll County Sheriff's Office. This approval will allow the single source vendor to continue this ongoing support without disruption in these services. This amount is covered by multiple awarded grants and has been approved by the Budget Office. No additional funds should be necessary.
So Commissioners, a hot topic is resiliency, wellness. For us, Dr. Miller is someone that I've worked with for many years since I became sheriff, is very valuable in the law enforcement arena with working on resiliency for deputies, for the organization, wellness overall, and then really just generally helping the organization work optimally, work efficiently. Just a great resource for us. So
It's been an ongoing.
yes, it has, and really has opened the eyes of leadership and working with us as a team to help us understand how we can work more optimally and be better leaders for the folks that work for us and right on down the line. So this funding helps Dr. Miller with us for quite some time, gets us to a better place. So
You know how I feel about this. I'm going to make the motion that the board approves the purchase of psychological services from Kimberly A. Miller and Associates in the amount of $45,000.
Second.
I got a motion in a couple of seconds. Any discussion? Seen here none. All in favor?
Aye.
Now let's talk about the Genesis Treatment Service.
All right. The Office of Procurement, in cooperation with the Carroll County Sheriff's Office, is requesting your approval to award a term contract to Genesis Treatment Services for assessments, medication, and related delivery services as part of the MAT program. The term contract would not exceed $109,000 per year. Funding has been approved through multiple grants awarded to the county. No additional funds should be required.
Mr. Genesis is a local business that supplies methadone for our medically assisted treatment program in the detention center. Those numbers have risen since we started the program on folks that need the assistance. The ability to dispense methadone is one of the preferred methods within the facility, so this grant will help us with administering
the methadone to the inmates that are there.
Motion to approve the award of a term contract to Genesis Treatment Services not to exceed $109,000 per year.
Second.
I have a motion and got a second. Any discussion on this one?
Is this somebody you've used in the past?
Yes, we currently use them now. It's just an expanded part of the contract. It helps us with getting more into the facility. We could talk about it too. I mean, I know the health department was here, and it's still up in the air over whether the program is something that we see as working, but I can tell you that folks that are in our jail that are leaving, the goal is to make sure that they're not purchasing anything that's on the street that has fentanyl in it, so we'd rather them use pharmaceutical grade stuff that we know that doesn't have a substance that's going to kill them. So we'll see how that program works, but right now it's a state mandate, and this helps us meet that mandate.
Any other discussion on this one? Seeing here none, all in favor?
Aye.
If I can get connected with Kimberly, if she goes by Kimberly or Kim,
absolutely.
like to
Absolutely.
just have that conversation. Some of the things that we've talked about, and
Absolutely.
experiences. And Ryan, cool Paisley shirt. I know the sheriff is jealous, but it takes a strong man to wear a shirt like that. And
They're actually flowers.
well, okay.
Yeah, I thought my eyes were bad, but yours are.
I'm just saying, so the sheriff is a little jealous, but it's okay.
Commissioner Rothstein is enamored because twice in a row you have said no additional funds are needed.
Exactly.
I make sure to always put it
That's
there.
what you're wearing, I guess. Thank you, gentlemen.
Okay,
Thank you all.
absolutely. Okay. Let's get an update from the Board of License Commissioners. Rules and regulations and approval for one piece of legislation. Okay, gentlemen, how you all doing?
Good morning, Commissioners, Ms. Wyndham. We're here before you today to request approval to update some Carroll County Board of License Commissioners rules and regulations and to approve one piece of legislation. All procedures have been followed as far as open meeting laws, as far as public hearings, voting by the Board of License Commissioners and so forth. At the present time, the rules and regulations of the Board of Commissioners and state code requires only that one person at each establishment be trained in an alcohol awareness class and receive certification. The legislation and rules of the Board of License Commissioners would require that an alcohol awareness trained and certified person must be on the premises by the establishment at all times the establishment is open. And at least one licensee must have received and completed alcohol awareness training. It would also mandate that the certificates for those so trained be available for inspection at any time. Quick background, state code, as I mentioned, only requires that a single person on a license or managerial experience in the establishment be required. That person could reside 6 months in Florida.
Right.
And be the owner of an establishment and on the licensee. We think as a Board of License Commissioners that there should be someone certified at all times while the door is open for public business to be required to have alcohol awareness training. In the past, comments were made about the organizations that provide training for this. 2 years ago, we felt that it was our duty as a Board of Commissioners for licensees to get an approved course for Carroll County that we could offer. And during those 2 years, we have trained almost 300 people throughout Carroll County, whereby we have had training sessions with as many as 38 people in attendance from one establishment. Other establishments go together, and we have a course. So far, we've got 5 scheduled so far in the coming year of '24. I would liken a comparison. That licensee now, as I said, could be anywheres. School board operators with school buses, I would liken it to having an example would be that only one of the real girls from Reel's Bus Transportation would be trained in the operation of a school bus. That doesn't seem practical to me because now each of the operators have to have a course and be approved each year. We would ask that this request be approved and be presented to the delegation for submission in Annapolis.
Because you have the training and that you've talked about, do you feel, is this going to put a hardship on any of the businesses, or you feel like this can be pretty fluid and they'll be able to comply?
Commissioner, to be perfectly honest with you, many of the Class B licensees, which basically are restaurant operations, many of those owners and operators thought that this was the rule that has been in existence for years, and it has not. Baltimore, Frederick County, Harford County, Kent County, Montgomery County, all have this in their particular county codes, subject to approval naturally, as the state code only requires one. Rules change, IDs change. The courses that they take encompass many, many different areas of operation of a restaurant or with an alcohol license. Fake IDs, too much drinking, not enough. Rules and regulations of not only the county, but also the state rules and regulations. The book about that thick, so on and so forth. We just think it's good business to have somebody on premises to really direct, to answer your question, the public hearing that we had. And before we proposed this, I'll back up a little bit, we had discussions with various businesses that would be affected by this. And the only question, not the only question, but the basic question, this accreditation is for 3 years.
4 years.
4 years, I'm sorry. And perhaps it could be for 5 years or maybe a little bit longer. That was the only comment, basically the only comment. Even the persons that made that comment were okay with the new regulations as far as that goes.
And Mr. Chairman, maybe you can help me to understand. So someone has to be on the premises that is alcohol aware, trained and certified. And so I can understand where you're coming from with that, but help me to understand the licensee, why you want them to be trained and certified as well.
My personal thought is, and as of the board, simply is that if you are awarded a license for a business, you should be fluent in the rules and regulations of that business that affronts your employees every day.
Simple common sense. And to Commissioner Kyler's point, this isn't going to impose some undue burden on businesses. You said you've met with a number of individuals who have these businesses who would be affected by a change in the rules.
When we had our public hearing, you all are most familiar with public hearings, one establishment was present for the public hearing. And the only comment that the basic comment that they made is the one that I mentioned to you about perhaps getting the length of time that the certification was upheld. And we suggested to them that that probably would be a state ruling, that on the state basis, and that's where that stands.
So if, and I'm going to ask this question, not just least of which because I don't know, but I don't drink at all, so I have no idea about this part of it. So if I was a licensee and I wanted to become alcohol aware, trained and certified, where do I go to do that? What kind of class? I mean, how long is it? How involved is it? Is it timely? Is it going to be time consuming?
Commissioner, I'm going to let our chief inspector answer that. Mr. Benford?
The class actually lasts 3 hours. We charge $50 a person. Myself and my part-time person, Jim Pullen, are both certified. It's a state certification, and the class itself was a state certification we had to obtain to teach this class. We offer it approximately 2 times a month. We actually not going to offer it in December because the restaurants are so busy. It doesn't make sense right now, so we're going to start back up in January.
And where do you do the classes?
Sometimes we do it at Westminster Library Exploration Commons. Sometimes we do it at their places establishments. Like in January, we have the Coon Club's going to host one, and then Flicks Pub's going to host one. So we have different locations.
So it's not like everybody has to go to one location every single time at certain times. You guys are flexible about these things and when people can get to them and where you hold them.
Right. With our training, there used to be one in Carroll County that they stopped, after COVID, they stopped doing the training. And they were not too flexible, but we've decided to be flexible. We actually done Saturday mornings. We do evenings. So we try to work around whatever the business owner wants, try to help them out as much as possible.
Awesome.
My view is a bit conflicted, is that we have the ability to strengthen state laws. We can't lessen the laws and make them less stringent. There's a baseline, and then from that we have the ability to request to strengthen them or to strengthen them sometimes ourselves. I don't like to do that. I, again, believe that, we should, as a community, be, just our community. And Carroll County is no Carroll County. Property rights, and just have the basic laws and run our county. So piling on additional, requirements, sometimes it bothers me. Now, the conflict is safety, security, best education, quality of life, is what Carroll County is all about. And if I focus on safety, security, that's exactly what this does. It allows for a better community to be safe. So that's the conflict, It's not an arbitrary law. It's a very focused to make ourselves a safer community. So with that outweighs the other issue. Knowing that surrounding counties also have that in place definitely helps in that sense, because the roads, a traveler isn't bound by the county line. They go
Yes, most
across wherever they may go. So I'm in favor of this, and I'll move that the Board of County Commissioners approve the changes to the rules and regulations of the Board of License Commissioners, and approve submission of the one piece of legislation to then be presented to the Carroll County delegation.
Second.
I have a motion and a second. Now it's open for any further discussion.
No, just very briefly, if it doesn't end up working out for us, we can always vote to rescind it, so.
Actually,
no,
this is state
State. It's a state.
legislation.
Oh, well.
And
Yeah.
it's somewhat of a courtesy that you're asking for us to back you on this, but it's state legislation.
Well, then, we can always vote
We
to
can always yell
proceed
at
to.
delegates.
Yeah, right.
Well, I'll just take this opportunity to say hello to Mr. Bronning. It's been I served under you on the Planning and Zoning Commission many years ago, so thank you for your service to the county.
So it's your fault.
That's right. You might be able to, him
your
and
fault.
Mr. Bale.
Speechless.
I might
I've
add.
never seen you speechless.
Well, I gotta be careful what I say. He mentioned bail. You all have the ability and the power to appoint all these commissions and so on and so forth. And when I had the privilege of serving on that other commission with Mr. Guerin, I think that commission was probably the easiest commission, the planning and zoning commission ever had, because we always adhered to Ed Willier, the former mayor of Union Bridge. His comment was, we can all agree to disagree, but we don't have to be disagreeable. We all had our speak at that time. We came to a conclusion, but when we left that room, whatever that decision was, each and every member of that commission, that was the decision that was made, whether they agreed with it or not. And I can truthfully say that I've had the privilege of serving now on the Board of License Commissioners for some time, and that attitude has always been the same. So, thank you all very much.
Well said. Just want to ensure we follow up with any other discussion. Seeing here none, all in favor?
Aye.
Thank you.
Thank you.
I have a question for you guys, not to discuss today. Your department, that you have some public coming in, you have a commission coming in and out. With Doug Brown's help, he's sitting behind you, so be cautious. With his help, we've modified how people get in and out of the building. I'd be curious sometime, send me an email, send me a text on how it's working, or if you think it ought to be tweaked more, or I'm sure Mr. Brown would love to hear from you too. But I just felt like you guys you've got public, you've got commissioners, you've got a lot of people coming in and out of the building, so I'd love to hear your input.
Okay, I'm sure Mr. Barnhart, our third commissioner, we'll get back to you. Just one last comment.
Yes, sir.
We are not the only ones that offer these classes. There are other classes offered by several other different organizations, so.
Fantastic.
Thank you very much.
Thank
you, gentlemen.
Thank you,
Thank
Mr.
you.
Browning.
Good luck, don't get old.
Okay, what we're going to do at this point is we are going to skip 6 and 7. We'll come back to it, but let's get to item number 8, which is the public hearing for the closure of Babylon Road. Chris, is there anyone on the line?
We have no one waiting on the phone line right now, sir.
Okay. What's your name, Mr. Burke?
Good morning, Commissioners. This is a public hearing to discuss and solicit public comment on a proposal to close a 1,200-foot section of Babylon Road. This was advertised in the Carroll County Times on November 1st, November 8th, and November 15th of this year. It was also posted with a notice on our Carroll County government website. With us are some staff from the Department of Public Works, Deputy Director Doug Brown, and our engineer, Chris Litnauchin. And they're here to tell you what they would like to do and why they want to do it, and to answer any questions you may have before we start taking public comment.
Okay, gentlemen.
Good morning, Commissioners.
Morning.
As a bit of a refresher for our audience, primarily on October 5th of this year, we came before you and provided a briefing about the structure or bridge on Babylon Road. And it is currently rated in fair condition, and we have started design and replacement of the bridge, but because of current site conditions, which Chris is going to explain here a little bit more, the cost of the replacement has increased significantly over time. And as a result of the increased costs and site conditions, we recommended that the structure not be replaced, but it remain open until such time it is no longer serviceable. And you then allowed us to come to this hearing. We appreciate it. And so, Chris, if you just provide a little more of the detail for our audience on our reasoning.
Okay. Good morning.
Morning.
Babylon Road is a structure over Silver Run.
is located just north of Cump Station Road and Maybury Road intersection. It's a single lane acro panel truss steel floor beams with a stringer structure. Was built in 1960.
I apologize. I believe you have slides as well.
Yeah, we do if we need.
Okay.
Do you want those up? They're the same
I mean,
ones.
if you're talking through it, may as
Yes,
well
sir.
for the community.
Not a problem.
So there's the structure. It was built in 1960 with some minor repairs to the abutments in 2016. As you can see in the pictures, it's currently posted for a 24,000-pound single unit vehicle and 43,000 pounds combination, which does have some impact to our fire and EMS folks. It's inspected every 2 years, with the truss itself being inspected every year, so we have eyes on it every year by our licensed professional engineers. Currently, with traffic counts collected in May of 23, there are 85 vehicles a day that cross this structure. We estimate the overall replacement costs in the new alignment will cost about $1.85 million, which the county's share of that would be approximately $625,000. And as we're seeing every day, the longer we have something in design, the design's costing more and the construction is costing more. So these numbers are, a few months old, and we don't expect them to go down. The new alignment will impact over 11,500 square feet of wetlands, and that will require us to go through a lengthy environmental process. The lifespan of the structure, steel bridges, they may last 30, 50, 70 years. It depends on the environmental conditions. As you can see, this structure is fairly close to the water, and when the water gets up, the water goes through the structure, and debris and mud and things like that. So a structure that may be higher up and has lots of sun and wind and doesn't have debris, usually you can see in this picture there's debris sitting on the one side of it. So that may accelerate the degradation of the structure. We don't know how long this structure is going to last, but with the FAIR rating, it prompted the state's goal, and our goal is to get rid of all our FAIR structures and replace all those. That's why we started the process.
Okay.
So, Commissioner, a couple of noteworthy things that Chris mentioned. One is wetlands. So, as you heard him say, in order for us to determine whether or not we can even build through the wetlands, we must go through the expense of any design process to get to that point. And we don't know what the outcome of that would be. But that would have to be done. The other thing, you also heard him mention weights. To put it in comparative design, the largest fire and rescue piece that can come across there now is an ambulance. Nothing else can travel across that because of its current weight restrictions. So that is the only thing, that size of a vehicle can come across it. So the reason that we're before you is very simple, and it is that we believe at this point that with the amount of traveling, we need to be prepared. What I mean by that is this allows us to know what direction you want us to take in either preparing for the eventuality that at some point in time something may happen that we can't repair, in which case we would have to close it. And we want to make sure that not only we are prepared, but other agencies, particularly public safety agencies and others that use the bridge right now would understand what the situation is. So this is all about, in the safety of the public, us trying to bring all our structures up with your help to where they need to be and prioritizing those. So, Commissioners, if you have any questions, we're glad to answer, but that's what we have for you.
I apologize. Before asking questions, if anyone is going to want to make comments, we have those salmon color cards. If you filled them out, that's great. If you haven't, please fill them out and provide them to Ms. Roberta, to my right, your left. And then we'll go from there. Thank you.
So two questions.
Yes, sir.
One, you inspect it at least once a year for various things, and of course, we're complaint-driven and storm-driven. You do it more often. So the potential, this could fail based on a storm, based on inspection in a year or two, or it could be 10 years from now. Is that correct?
That's absolutely correct. It could be even longer than that. As you heard Chris mention, this bridge, I believe right now is, what's our current age? It was 1960. So that we're, 63 years old. We have known of them in the 70-year span of lasting. It could be that. On the other hand, we could have a storm event that brings a tree limb down that's the wrong size. It comes and contacts it and puts us out of business. We certainly hope that's not the case, but that is the possibility.
So the bridge is slightly older than Commissioner Rothstein, but not as old as I am. Have you heard any negative or positive feedback from either the school system or the emergency vehicles people?
So I can't speak to the school system. Perhaps Chris can on that. I can speak to emergency services. We have been in contact with our Department of Fire and Emergency Services. Also, we have heard from our local fire chief in that area. Obviously, no one in public safety is in favor of anything that's going to increase response times anywhere. Right. So, yes, absolutely. Even though they can only respond to ambulances, we know that life is the most important thing that they save, and obviously to get an ambulance across is key. The goal, again, in this and our open discussions has been that there are, we would say, 3 companies, 1 on the Pennsylvania side, 2 on the Maryland side, that respond into that area. If a decision was made in this direction to ultimately go to closure, then that would also allow time for the workarounds, the routing of travel, and the rerouting of response assignments through fire and rescue. But yes, communicated, and we have heard some negative feedback. Yes, sir.
With the 24,000-pound posting, first of all, it was a gravel road recently hardened, so the school buses would not travel that. And a 24,000-pound single axle, most of those buses cannot cross that structure now.
Okay, thanks.
So at present, and remind me, because I think it's briefly been talked about in October, we are currently repairing this bridge and doing our best to keep it open now. I know that you had mentioned, I think at some point, that we do have certain replacement parts to continue to repair the bridge. Do you have any idea, based on the analysis, how long we would be able to continue to repair the bridge?
No.
Short answer. That is
Okay.
the short answer is no, because it all depends on what, a panel on top. Certainly, we can probably have a panel fabricated. There are lots of metal areas. Anything underneath, so the main supports that, as Chris mentioned earlier, we are inspecting on an annual basis. Should something hit that, should that degrade to the point that we can't go on top of it, that would be the end point. But the smaller stuff that we can weld, replace a panel, yeah, we're going to continue to do that. That's not the point at all. If the bridge wasn't serviceable, it would be closed today. And our point is, we're going to continue to service it, just seeking that direction of which way we need to go from you.
When was the last time water went over the bridge?
I don't know that. Looking at some of the debris from this picture, which was the last inspection, probably fairly recently.
Yep.
And I'm sure citizens in that area might be able to tell us.
Yeah, I'd be interested to hear that. Then the other is the time associated with circumventing this area. If that bridge is no longer there, to get from point A to point B, there's always going to be a and B somehow.
There is. So, current travel times now for Pleasant Valley Fire Department, which is the first due fire department there, with it open, it depending upon there is about 5.8, 5.9 miles, 11 minutes.
And these are Google travel times,
Right.
not emergency
These aren't-
vehicle
right.
response times.
Oh, got
I
it.
don't have any way to model how fast the.
It's all good.
Should you decide on a closure, travel time for that same company, Pleasant Valley via Route 97, would be 10.5 miles. It's 19 minutes. And Arters Mill Road route of travel would be 11.3 miles, 22 minutes. At that point, actually, Tawnytown within county becomes closer because their travel time is 9.1 miles or 15 minutes, within 4 minutes of what it originally was. And then also the mutual aid company, which is out of Littlestown, the Alpha Fire Company, actually has a 13-minute response time from the north should that road be closed.
Those that are in the community now saying it's a workforce moving south, we're really talking going from 11 minutes to 19 minutes.
This is to
Just
the
the opposite
house.
direction
Yeah,
from-
it's only, the distance is for the house that's closest to the structure. So those who live north of the structure would have,
A couple
it's
more
faster.
minutes.
Yes.
Yeah, no, I got you.
A little bit faster.
Okay, yeah. The total cost to replace is 1.85 million. Our cost is 650,000.
625,000 currently.
625,000. I apologize.
Currently.
Yeah, that's today's numbers.
Does that include engineering and getting through the wetlands and all that, or is that just construction?
Yes, that includes
Engineering.
the engineering at this point.
I
A
know.
recent final design, that we just got was another $80,000 more than we had expected 3 months ago. So
Okay.
And remind me again how the wetlands factor into all of this?
We don't know if we will get approval. So ultimately, the environmental agencies have the ability to either approve or deny any project. So we don't know yet what criteria we will have to meet and if it would even be approved to go through there. They may say, for example, well, no, because you could go in this direction, and so we're not going to allow you to use these wetlands.
But just because it is wetlands, we have to go through that process.
Absolutely.
we have to mitigate the impacts to
Yeah,
the wetlands.
Anything that would happen in the wetland, we have to take care of. So whether it's wildlife or any other factor that would be concerning, we'd have to address, which could elevate the cost depending upon what that is.
And it doesn't matter how long the wetlands have been there, just the fact that there are wetlands there, that's the. Okay.
Yes.
Yes.
And just to refresh my memory, so if the bridge was replaced just how it is now, that those issues with the marshland and wetlands would still occur?
Yeah, the design, we cannot replace it in its current location because of the way it is and the opening and the flooding potential. So the new alignment is just off of the existing
There it is.
structure. So this would be the new crossing here.
So go back that one picture. Where
Which one,
are we
this one?
talking? Yeah, where are we, no, there. Where are we talking?
So this would be the new structure right
Right.
here.
Okay.
And then we would come back.
Yep.
Come back as quickly as we can to minimize those impacts. As you see the hatched areas and things, those are the areas of wetland impacts.
Right. Yeah, if you can go back to the there you go. Just leave it on that for a sec. Okay. Any other questions for these gentlemen? Okay, what I'd like to do is open it up for the community for comments. Again, Chris, there's no one on the phone I still expect, so if you put up your timer, just for comments, it's not a discussion period, it's more one way, for us to listen and learn what you have to share. You have 3 minutes. I'm pretty liberal on the 3 minutes, but around 3 minutes, please, come to an end. If comments have already been made, feel free just to say, like he said or like she said, and we're just going to gather those. So, Roberta, you've got the con.
Matthew Luzuriaga. Microphone, and state your name and address and your comment.
Still good morning. Morning. Good morning, Commissioners. My name is Matt Lazuriaga. I've been before you on a couple of occasions, and usually in that role, I'm representing a developer or a client or something like that. As you know, I'm a lawyer, and I know this board's feelings on lawyers, so I'm going to try and be a little bit more personable today. I'm here today as a taxpayer, as a son, as a father, and as somebody who volunteers in Manchester and wrestling and North Carolina soccer. I've got kids, businesses, property in this community, and I'm invested. My parents live on Babylon Road. I grew up on Babylon Road. This road has been a problem since before I was born. My parents bought, and they may even tell you, developed their property based on promises from the county that this road would be relocated and improved 40 years ago. All I've heard the staff tell you, which I understand the 5 of you depend on greatly, and you have to because of the scope of your job. All I've heard this staff say is, we don't know if we can do it. If we can do it, it's probably going to be expensive. And what's not being said, but I think what is evident, is there's not many people that live out there. And there's not many people that are here to speak in opposition. I think, and some of you have seen before in other notification procedures, like for zoning cases, where a neighbor wants to put something up, just do something different on their property. The applicant, in this case the county, would be required to notify every single adjoining property owner by mail that this is happening. I think if that happened in this instance, you'd have more than a few people here today to tell you how much this bridge is used. What you heard from the county's own, when asked, data is at a minimum, it's going to double response times for an ambulance. I think that you can direct your staff to say, not everything we do is easy, not everything we do is inexpensive, but we're here in a role that, thankfully, there's 5 of you. I think if this were a charter government county, something like this might go through very quickly. Maybe we need to look at this a little bit closer. And the folks that are out there, honestly, ask the least of this government. Their road just got surfaced. They don't have public water. They don't have public sewer. They live out there because they want to be left alone. And if you're going to make it harder for them to get home or for them to get out, let's make sure we're doing it for the right reasons, not we just can't figure it out. Thanks.
No, thank you.
Thank you, and I know this isn't question and answer, but you were much nicer. Is it because you weren't representing somebody, or it was because of who was sitting behind you?
Exactly.
It's because they're right here.
That's a very good answer.
Michael Lizuriaga.
Good morning. I see now that the law school tuition was worth it. You had a spirited discussion earlier when Dr. Wack was here about disinformation and having a credible source. Well, before we purchased this property in 1981, I went to what I thought was a credible source. I went to the government. And I spoke with Commissioner Roger Mann, who directed me to Jack Sterling, who pulled out all the maps for the quote-unquote dirt roads program. And his words are burned in my memory. 3 years max, you'll be paved. That's 1981. We built in 83. We've been waiting literally 40 years for that road to be paved, okay? And it's tarred and chipped, which is infinitely better than what we had. 40 years I practiced in Westminster. I came down that bridge, through that bridge at least twice a day, right? If that bridge were to be removed, it adds 4.5 miles to my trip home from Westminster, okay? Your question was, when was the last time the water went over the bridge? And I'll be glad to be corrected by my neighbors, but since they put that concrete underneath of it, I've not seen any water go over that bridge at all, okay? It's serviceable to us. I find it hard to believe that with the resources that we have in Carroll County, that we can't come up with the money to replace that bridge, or at least have parts fabricated that fit underneath there. The previous meeting, it was alluded that I was okay with the removal of the bridge. Well, no, I wasn't. Okay, when I wrote to Tom Rio, I said, at that time, he says, it's not going to be paved ever because we're having trouble with the right-of-way down at the end of the road. You're all familiar with it, all right? And I said, fine. Pave the road down to where the county owns it, all right? And then take the bridge out. Well, if that's the only way it's going to get paved, well, need to say nothing happened after that either, until all of a sudden, and I don't know where the money came from. Who knows, it was COVID money or whatever, but the county's paving half the roads in that section, all right? And again, I'm pleased. The roads people have done an excellent job. They kept me informed and all, but I ask you to vote no with regard to this request, all right? And and continue in negotiations with the owner at the end of the road to see if you can come to an agreement so that we can still use that. Okay? Thank you.
Thank you. And that was a very deliberate decision to pave those roads a few years ago, so.
John Miller.
What's the last name?
Well, it's maybe Million, yeah.
Could you kindly put Doug's picture of the bridge back up?
Sure.
That was
Which
up
one,
there before.
which one did you want?
What the picture Doug put up?
Is that the one you want? Or the
Yeah,
bridge?
right.
Okay.
Yeah, now would you kindly put my pictures up of the bridge?
What we...
You can't?
No.
No.
Okay.
The ones you just handed out?
What?
Whatever you just handed out?
No.
What are you
I
going
don't
to
have
way
a
to
way
do
of
it?
doing that.
So we can either put this
Well,
one...
you've had a chance to look at the real bridge.
Yes.
It's not this beautiful bridge you see here. The foundation has been deteriorating as Department of Public Works, Debbie Butler and Tom Rio have stated in print. The foundation is totally deteriorated. February of 2014, a bridge had sunk on the east side 3.5 inches. I just went out and measured the bridge just yesterday, and it's sunk another 3 inches. So that's approximately 8 inches in the last 10, 15 years. The bridge is unsafe. The bridge is unsafe. I got a memo here from the fire department that says they can't cross the bridge, which puts all the people in the Babylon Road community in fire. They can't get the fire department to the burning house. And you said an extra 10 minutes to get to my house, there wouldn't be anything left, and you know it. And if I was having a heart attack, you might as well skip calling the ambulance, just call it a hearse. And I've been dealing with this bridge since 1989. I bought the property in 1989. Like the Lozuriagas, who are my neighbors, I was promised that the bridge would be replaced in 1989. And it's been a long time, and they're not replacing it. I can only say that from being in the Pleasant Valley Fire Department, it's a real kick in the butt to know that if my house is burning, as a fire department driver, I got to drive an extra 20 minutes to get to the house. Safety is important, and I'll give the pictures when you give them back to me, to the community members here, so they can see what the real bridge looks like. I think that's all I have to say.
Mr. Million, when did you take those pictures?
2016.
He has it date stamped.
That's the date stamp on it.
Yes,
Okay, thank you.
2023 and 2016.
16.
Thanks.
Yep. Thank you, sir.
Tom Irwin.
I've got.
Hello.
Morning.
As has been stated, the bridge in question has been going on for 40 years, and the county owns some ground where they're supposed to replace and put the bridge and straighten Babylon Road out. What I haven't heard yet is the fact that where the bridge is and the closure they're talking about is actually on a prescriptive right-of-way. Now, prescriptive right-of-way is one that you have many of in Carroll County, where originally they were not maintained by the county. They were private roads. Many of them would connect one farm to the next farm to the main artery road. So in essence, they were used for internal use to get out to the major road and byways. These public roads they connected to were county and state roads. As time progressed and our county was a big milk shipping county, a lot of these were used for milk trucks to carry. Somewhere along the way, the county decided that they were going to maintain these roads, and now we have prescriptive right-of-way. So the county fixes them up, plows the snow, and does whatever, but there's no deeded right-of-way through these places. The people that own that ground still own it, they still pay tax on it, and yet now it's become a public road that's maintained by the county. So my question to the board, or to anybody that can answer, because I've got a place that's got a prescriptive right-of-way, and I'm sure many other folks do also, what happens if you close it? You're going to tear the bridge out? Is that what happens? Do you tear the road up? Does the guy who has, like my farm, if you decide to do that with my place, how do I get out of there? Do I got to make my own road? If you close this down and choose not to fix this bridge, are these people allowed to go back to private use and maintain it themselves? You already talked about having an ambulance double the time to get somewhere. You know, this time is critical. Recently, I say recently, the last few years, a neighboring field of mine caught on fire. And they didn't have big tandem axle fire trucks or anything else come out to address that. The ones that got the job done were brush trucks. They're heavy-sized pickup trucks. That's going to get across that bridge. I had to go and chisel plow a spot to keep it from getting to my buildings. But by taking away that bridge, you're going to really endanger, for a number of reasons, that end of the area that people can't get to. I'm just reading over my notes, make sure I didn't miss anything too much, but I am very concerned about the prescriptive right-of-way, and if you elect to close it, what's your next step? Is the bridge going to be removed? Are you going to gate it off so nobody can use it? Are you going to discriminate on who can use it, just the owner and some neighbors that he or she chooses? Give that a little thought. Thank you.
Thank you, sir.
Walt Corzera.
Yeah, I'd like to talk about how to replace the bridge. If concrete and steel is too expensive, I got a company here called York Bridge Concepts. They're out of Florida. They do bridges. The closest one that I can show you is the job I worked on right here off of 795, Franklin Boulevard. You got the Quarry condos right there. You come off 795, you hit the stop sign, 1,500 feet straight ahead. It's a 2-lane bridge with a double yellow line. It's made out of timber, and it's got a 6-foot walkway on the left side of it. I watched the guys build this bridge. They did a great job, and it's cheaper than concrete and steel. That's why it was put in there. And you got these bridges all over the county. You just can't keep closing roads every time you run into a problem. You got to figure out how to fix it and the cheapest way to do it. Maybe I've got the number and the email for this company, and this guy he'll talk to you on the phone. His name's Titus, and it's a different way to go about trying to get the same problem you want. They got another bridge that they built in the area. It's at a school, but it's approximately the same size as the bridge that we're replacing. I think it can be done cheaper, and it'll be just as sturdy. When you drive across this bridge right here in Reisterstown, you won't even know that you're on a wooden bridge because it feels like concrete. They got 18-wheelers go across it, fire trucks. Like I said, it has a double yellow line. But it's a way to get around the problem that you have. I know it's expensive. All that construction's expensive. If you can close the road, I got 45 years in construction. I can get that bridge taken down. That'll save you money. I'll take it down. Any way we can get this thing and keep it moving, even if I got to put some money up to get that bridge back up for everybody on that road, I'll do it. So let's try to figure out a way to make this thing work instead of making it stop here and creating more problems. You're going to have problems in this county all over. You got plenty of bridges that need to be replaced on a lot of roads. You go off the main roads in this county. I work in 6 major counties in this state, and this is one of the worst counties I'm in that I live in. And I worry about my kids when they start learning how to driving on these back roads back here, and elderly people too, because let's face it, you guys cheated on building these roads back in the day. Now you're having to pay for it because they're in a mess. We're driving around $50,000 trucks and cars on gravel roads. And like the man said before, they told us that they told me 25 years ago, they came up and we're going to raise my taxes. I said, well, whatever anybody wants down the road, we'll go ahead and pave this thing and then take care of the bridge when it's time for the bridge to be repaired.
Thank you.
Like I said, I think it needs to be left open. And especially, I don't even think the ambulance can get across that bridge now. Because Kingsdale closed up in Pennsylvania. We don't have that fire department no more. That's the only place that used to respond to the Silver Run area. Littlestown very seldom comes there, and when Pleasant Valley or Westminster comes, it takes them another 10 minutes to get to it.
Thank you, sir.
David Bell.
As she said, my name's David Bell. I live at 4501. It's approximately a mile north of the bridge. I moved there 13 years ago, which is relatively newcomer for some of these people. Appreciate the road being tar and chipped this year. That was a huge improvement. Keeps it from washing out. My truck doesn't look like it's a different color on the bottom. One thing I had to add that I don't think anybody's thought about, we're getting a rather large Amish community in the upper northern Carroll County, and when they have to go around, it's not another 10 minutes for them. They travel back, you can see the marks on the road. It's going to be another half hour to 40 minutes for them to go back and forth within their community. It's just a point that I wanted to point out. Pretty much everybody else has said everything that I wanted to say. Thank you.
No, thank you. Good point.
Tasha Moore.
Good afternoon.
Good afternoon.
I'm Tasha Moore. I live at 4151 Babylon Road, just a mile from the bridge. And everyone has said wonderful things. First speaker was amazing, so he pretty much said everything I'd like to say.
Don't give him too much credit.
But, you know, I've lived there going on 13 years, and that connection to get to 97 or 140 just right off the bridge has made my life easy. Plus, I also have the bus stop there. I put my kids on the bus, so that would be a hindrance for me, or at least my son, who he has all of his friends that rode the bus since he was in elementary school. So that's all I have to say.
Thank you, Tasha. Next.
Dan Moore.
Yes, good afternoon. Just wanted to add on to Tasha's comments and I was just curious about one thing that was never addressed. All the promises that were made by the county where are the excuses, or what was the delay? And I also hear that you're going to have to submit to see if you could go through the wetlands. What is the delay in that process? I mean, that should have been done, as far as I'm concerned, years ago, back in 2016 when you first started this process, because you knew that it was a wetland area. So, and like I said, I've been associated up there for the past 13 years, and yes, the paving of the road was monumental. And so I just think that these folks are owed, some comment from the board here on why the delay, and what's going to happen next. And it's been said that we all need the road, and it's something I don't think you can just close. Thank you.
Thank you, sir.
And one comment card with two folks on it. I don't know if you both want to speak or just one of you, but Mike and/or Jessica. Justin.
Good afternoon.
In
My name is
harmony.
Mike Dustin and my wife Jessica. We live on Babylon Road, 4705. I've been listening to what everyone says and just some key points. First one with the Amish. Yeah, it'll take their route longer. I don't know if you're concerned about that, but I'm more concerned about, I believe it was a child that was caught in an accident. So to put them out on different roads instead of back roads throws a threat into them and their family. First thing. Second thing, we moved in or bought property in '99, so we're getting close to 25 years, and we just got our road paved, which you just heard, which took forever. We don't have public water, we don't have public sewer, which we expect, but we don't even have cable, internet, or anything down there. I'm fine. We want to be back there quiet and by ourselves, but that road is a huge part to everybody. The other thing is I got to say, my children, the response time for services, all of them across the board will just be doubled. So I'm concerned about that. In the 24 years plus that I've been there, and I'm not there every day, but I cross that bridge a lot, I've never seen it flood. So just to what they had to say, I've never seen it that picture, and the gentleman back here gets better pictures, but that's just a pool.
Right.
They took that picture right. That's just a pool of water. That S turns in pools right there. That's it. It's not like a big flowing river that looks like that. A lot of debris comes down. It's usually just twigs and sticks. No trees, nothing like that come through there on a fast flow. I want to give my wife some time. But the other thing is you guys did a bridge on Mayberry about a half a mile off of 140. I am a builder and a developer. I deal with you guys all the time in the wetlands in the county and the state and all that. So my concern is you can get through the wetlands and the state. You did that bridge and you did that, and that was a bigger opening, bigger gap, more volume of water. So there is a way to get through that.
Nope. Okay. Thanks, Mike.
And I appreciate the ability to come here, and I wish my neighbors had the ability to come here. I heard secondhand that this was closing, and I come to this meeting first time ever I've been a county resident my whole 50 years, first time ever coming here. I sat here, listened to the healthcare workers. I'm a local nurse in the hospital, and I hear you talk about community and communication and the ability to make decisions as a community when that didn't happen in this. As disappointing as it was, because I heard secondhand. My kids also, who are adults, go to Westminster. It's my route to go over that bridge when I go to the hospital in the winter months and the school times. And I'm one of probably many on that road that use that. And I have to go to work when it's snowing and icy, and no one wants to go down 97 on the curvy roads. So I feel like I think it needs to be second considered that our community and our people that live on that road need that road, and that the communication to the people that live there should at least have that voice.
Okay. Thank you.
Thanks
Are there
for
any
listening.
others?
That was all.
Okay, and just to address that last comment, it is a challenge to communicate these activities and when these hearings are. I definitely understand that, and I hear that a lot. We, I want to say, do our best. We do our best at this point on what to let people know that these hearings happen. Can we do better? Absolutely. And we try and we learn. Okay, who else needs to know that these are happening? So it's a very good point, very valid point. I appreciate all the comments that have been made so far. A lot of them are there things we want to address back to to Doug and Chris at this time.
Yeah, so it's not a good answer, but I suspect one of the reasons a lot of the residents weren't notified of this meeting is because there's no plans to close the bridge at this time. Is that an accurate statement?
I mean,
Well, yeah, typically, the accurate statement is we come through, it goes through the public hearing process, and that's the process that we follow, which is handled by the county attorney's office.
Okay, all right, so, all right then, thank you for that.
I think it's
Secondly,
set out in Comar, correct?
Yeah, it is. It's Comar regulation, right?
State law.
State law.
okay, and then secondly, we saw some pictures from 2016. I've just got enough engineering experience to be dangerous. I saw some pictures from 2016 where those abutments, or at least one of the abutments, was completely in shambles. Okay, both of them, but I'm looking at this picture here, and I'm seeing a completely different set of abutments. So what exists?
We made
today?
repairs in 2016, as we indicated earlier.
Okay,
to the
so
abutments.
the pictures the gentleman had were examples of how it could be.
No, sir, I apologize. Let us have
that-
this conversation.
Is that okay?
Sure.
So is that accurate?
Correct. Those
Okay.
repairs were made, I haven't seen the pictures that he provided you, Commissioner, but those repairs were made in 2016.
So this is an after.
That
Yes,
is
that
after
was-
repairs.
That
those-
was in the last inspection
Okay,
report.
because those
Yep.
pictures look like a bunch of like crackers that are just got wet and fell
So
apart.
there,
That
it was
looks
a
pretty bad.
dry, I believe it's a dry stacked abutment, which they dry stack rocks. That was a very common practice
Okay.
when this was built.
Yeah. Okay. I just want to clarify.
No,
'cause
no,
we're
and then
looking
it
at
was
a tale
changed
of
from
two
that to
cities
the
here.
poured
Okay.
concrete.
Yes,
Sure,
it's
no,
20
that's- absolutely.
Okay, thank you.
It's one of those remedial measures we did in 2016.
Sure.
And this is the accurate look right now, is what you're
The
saying.
last report.
This was the last bridge
Okay.
inspection, that's what's
Okay.
filed.
So so I get the differences in the date and the times on the photographs, but the photographs that we saw from yesterday and I guess the recent couple of months where the bridge is depressing on one side versus the other. Do you know anything about that? What that
I haven't seen them. I can't speak to it.
Yeah.
is? It possible to give these gentlemen the photographs of the?
You want me to give Doug Brown?
Yes, please. Yeah.
Those are old.
Right. Yes, that was the previous stack job.
Yes.
You're looking at, yeah, these are dated, and that's,
Oh, no, I'm sorry. The one where you have the level and you've gone out to look at the degree of tilt for the bridge.
These are
That's
dated
across the
16th.
bridge.
These are dated the 16th.
I don't
Of
know
this
what I'm
month.
looking at.
Of November.
Better.
what are you trying to demonstrate, sir? Because you're going across the top rails on the.
I'm demonstrating that on the east side of this bridge. It's sunk 8 inches since its inception. And I guess the bridge people didn't pick that up. Apparently not.
I'm not sure what we're looking at. I can't
Yeah,
see on that side what it's sitting on or what we're measuring to and from.
So to confirm, Commissioner, from the last bridge report, we don't have this, and we would have to go out to actually see
if
that. I
it's
mean, I
level.
understand what the picture's showing. I'm just saying we can't confirm it.
Okay.
There you go, Mr. Mayor.
You do recognize the foundation is shot.
So that was the old foundation before the concrete repair, when it was stacked stone, the 2016 pictures?
No, it looks like that today.
Well, we would certainly be out there on it, but that's,
We don't perform the inspections. We have an outside firm because this is
Right,
a federal aid structure. So we have an independent
2016
engineer that does our independent
And
reviews.
they were working on the bridge that particular day, replacing some of the I-beams.
right, and after 2016, we did the concrete work on that, right?
Bear with me 1 second.
And this is also a 16.
This is a 16, but
So I
they
get-
didn't do concrete work on that side.
Okay. Yep.
Okay, Doug.
What's underneath the concrete? Are you telling me that the veneer concrete you put up?
So that
Structurally
was,
sound?
well, what we said is, well, it is sound, it passes inspection, and that's why the weight ratings have been degraded over the years to what they are right now.
Yeah, because like,
Doug, I apologize. Let us, I appreciate it, sir.
I think we've had enough public comment, and I personally think we'd be disingenuous, I'm trying to think of a nice word. To vote today to close the road, but I think we'd need to vote to close the public hearing and keep the record open for 10 days. I think we need to do that, but I think there's been enough public comment that I think we need to delve into this a little more deeply.
I agree.
Yeah, I agree. I'm, you know, when it's brought up about different options, the gentleman talking about a different bridge structure, I know nothing about that. You know, it's, you know, I'm a pig looking at a wristwatch when it comes to that type of stuff. So,
One more question, though. You feel like you've exercised about as much as you can trying to acquire more right-of-way. You feel like that's at a dead end, correct?
From the last meeting that I participated in with the property owner to acquire the needed right-of-way, yes, that was left at a dead end, and we've had no communication.
With that, you could avoid wetlands. Without that, you cannot.
No, we're still going to
You have wetlands either
We
way.
would still have a bit of impact, just not as much.
Not as much.
Correct.
Okay.
We would-
It
'cause
would
we-
minimize the impact.
That's
and
correct.
maybe the
It would
mitigation.
minimize the impact to wetlands.
But the state could still come back to you and say, if you did get that right away, you could minimize your damage to the wetlands, and therefore we won't let you go the other way. That could still happen.
We feel pretty comfortable saying that they're not going to let us go straight through all those wetlands. Based on our discussions, that impact is not, you know, something that is in the best interest from the state standpoint.
Okay. And yeah, and thank you, but I still feel like we need to close the public hearing, but look at this more.
okay, so I got a motion to close the public hearing at this time and keep the record open for a period of 10 days. Is that correct?
Yes.
Is that what you did? Okay.
Yes, that suits me.
Is there a second on that motion?
Second?
That's 10 calendar days.
10 calendar days, as opposed to 10 working days?
You'd be amazed.
Okay, 10 calendar days. Is that correct, Commissioner
Yes,
Fowler?
yes, 10 calendar days.
Yes, sir.
Okay. Any further discussion on that?
I guess just like one quick, I guess, point. Can we get someone out to look at that bridge about the tilt as soon as
Absolutely.
possible? All right, thank you very much.
Any further discussion? Appreciate that. Appreciate all of the input that has been provided to us this morning. All those in favor?
Aye.
Thank you.
Thank you. Thank you, everybody.
Thank you, folks, for coming, and officially, it is now good afternoon.
Okay, let's go back to item something.
6.
Item 6, which is update to the Board of Commissioners by Department of Human Resources on implemented and ongoing initiatives.
Good afternoon.
2023 beyond. Dylan Goldberg.
Control that thing? Am I supposed to hit that? No, I just think a little bit different. A little bit over here. Slideshow.
Roberta, could we have, or could I have someone, or have Wanda send an email to Jane Sewell, because I'm pretty sure we're not going to make the Christmas tree stuff at the Farm Museum this afternoon. I don't have my phone with me, otherwise I would just send her an email.
What time is it?
Oh, thank you.
It's,
'Cause I can't imagine that, you know, between the end of this meeting and then closed afterwards, we're gonna, thank you very much.
And for the record, my wife yelled at me this morning because I said this meeting was going to last past 1 o'clock, and she said, "How do you know that already?" And I said, "I think we're safe."
I hope you bet money
Not-
on that.
Not that Rhonda would ever yell at me.
I won't repeat that.
Is this public?
Yes. Oh, yeah, you're Rhonda. Hi, Rhonda.
Hi, Rhonda. All right, good afternoon, Commissioners.
Good afternoon.
We are here, last December, I came before the prior board, and I was a whole 2.5 months into my career here at Carroll County Government, and presented some information regarding the results of the compensation classification and organizational design assessment, and then ongoing initiatives for human resources. So we are here to report back on those initiatives and talk about the future and some of the things that we're working on. It was exciting, I said to Roberta yesterday, to go through this exercise of putting this together because it does show the achievements that we had. So with me, I have Robin Hooper, HR Manager, and Lori Hierstetter, Manager of Compensation and Classification. So we'll start with an update on recruitment, compensation, classification, and retention. In 2023, we have hired 214 employees since January 1st. That is because 141 of them were Department of Fire and EMS. There were 4 pretty significant groups. One of them actually had 72 people hired in them. So this was quite the accomplishment. I think a process that was in the works for quite some time. Not without its hiccups. We certainly had them, but I think we're rolling along right now and doing a good job with the hiring. We're using our Vista Career Center for that hiring, which allows employees to, or potential employees to go in and enter their competencies, their certifications, do everything online, set up a profile, apply for several different positions at one time, and then, as you know, the process works through a written exam, physical ability test, position-specific testing, and then all the background checks that happen, and we are responsible for coordinating all that. So that has been quite a successful venture for 2023, and we're glad that that's moving along. We've reviewed position statuses as part of our conversion for the Human Resource Information System, and we converted 34 positions from contingent to regular status back on July 6th, and we're converting another 13 positions from contractual to regular status on December 7th. So what we had was two additional statuses of employees. One was contingent. The other is contractual. Contractual will remain. Contingent has been eliminated. Those were funded positions from grants and things like that. They were treated differently than regular employees. So we took a look at that. It was a recruitment and a retention issue. We heard from directors that they were having trouble filling those positions, keeping staff in those positions because they were not treated the same as someone they were sitting next to. So we implemented that and moved them over in July.
You're saying they were eliminated, there's now 0?
There's no contingent status, yes. Yep.
They've moved to regular.
They moved to
Yes,
regular.
yes.
Yep. And then, as you know, we had recruitment of key leadership positions. So we recruited the Deputy County Administrator, the Director of Public Safety, the Director of Parks and Rec, and we're just finishing up the Deputy Director of Planning and Land Management. Continuing the update, one of our largest projects to date, which Lori is responsible for heading up, is our position description project. You may remember early on in the year, you were part of establishing core and leadership competencies for this project. Our core competencies are service excellence, collaborating with others, and decision-making. And our leadership competencies are exemplifying integrity, holistic thinking, and inspirational leadership. Directors and their teams have established job family and job specific competencies and levels associated for each position in their organization. The competency levels are going to assist with the development of career paths for employees, so it sets what skills are needed for each position. That will be part of the job description going forward, and we'll talk a little bit more about the layout and the modernization of that as we go through this. And the position description software also provides interview questions based on those competencies. So we've already had a few directors use these and find them very helpful. They're very behavioral based, so it's not a yes/no answer. It really gets candidates to think how they can use those competencies to perform the functions of the job that they're interviewing for.
I really like the core and leadership competencies. Really well done.
Board helped develop them.
That's right. It was a democratic process. We also just recently, as many of you know, we have an intern in our office, and he has assisted us with developing what is called an employee value proposition. And what that is when someone is reviewing our job postings, we want them to be able to tell from that posting why they should work for Carroll County government over anywhere else. So our we tried to hone in on 3 words that we think we want to be the basis of that, and they are connected, inspired, and committed. And our employee value proposition, more like a mission statement or what we want to be out there, is at Carroll County government, we're looking for people who are eager to engage in meaningful work that has a positive impact on our community. Our motivation to work hard starts with the value we put on our relationships with coworkers, community partners, and those we serve. We strive to build collaborative and passionate teams with opportunities to learn and explore new possibilities in a welcoming workplace. As a team, we are connected, inspired, and committed to serve. So we're going to start using that in our marketing material. We're going to put that out on our website. We're going to hone in on those 3 words and really try to draw applicants and individuals interested in public service to apply and hopefully become employees of our organization.
Who's responsible for this?
This was actually headed up by our intern. So
This is very, very good.
yes, it was great work. So we were glad to have
Yeah.
him on board.
Yeah.
On the next slide, ongoing implementation of flexible work schedules and telework opportunities. That has certainly helped in our recruitment pieces as well. We've changed the format, as you, those that attended might remember, the employee recognition event. We had a breakfast instead of the usual event. We started a stay interview program with employees who have 5 to 10 years of service. We've conducted 2 of them, so we're still building trends from those interviews and looking at that program and how we can revamp it based on the feedback we're getting from the employees that participate. And then we also did a 911 employee engagement survey. So we have some action items coming out of that for the Department of 911 that we're excited about and hoping to improve the recruitment and retention there as well. Going on to the future, some of the goals that we have for the recruitment, compensation, classification, and retention team. As I mentioned, that position description project, we early on in 2024 hope to finalize approximately 400 redeveloped position descriptions. They're going to be validated by each director. We're going to use a new template, which will include those competencies and updated duties and responsibilities, education and experience, licensing and certifications, and physical ability requirements. We're going to, the goal, one of the main goals of this is to use consistent language and format. We're going to review exempt and non-exempt status of positions, we're going to create a new classification levels, place the positions in various levels using a standardized evaluation tool. And then one of the goals of that is to ensure that we have ongoing competitive salaries to remain competitive in the recruitment environment. Establishment of career ladder and lattice criteria and guidelines, revision of the performance evaluation program and tools, and succession planning.
Go ahead, please.
sorry.
No, please.
The exempt versus non-exempt, does that have the potential to change over times?
It does, yes.
How do you think?
I'm not sure. We really haven't looked at it because we don't have updated job descriptions. We need to make sure that the duties are well-defined in the job descriptions, and then we can make that assessment.
Before you do, yeah.
Yeah.
Okay.
Yep.
Thanks.
The ongoing competitive salaries, something out of your hands. I mean, it's, you know, that's our role and responsibility. Establishing, it's not necessarily from your perspective ensuring ongoing competitive salaries. It's establishing a salary guidelines or salary, development tool for us to then make a decision.
Right.
Because everything else you can accomplish, the ladders, the guideline, all that, but
Right.
that is something that you cannot.
Without your approval and the budget, the guidelines of the budget.
Right, but what you can do is prepare us,
Right.
saying this is why you want to make this decision.
Yeah,
So-
so using,
Okay.
competitive information from our neighboring counties and
Right.
the MACO
Yeah.
survey and
Yep.
all that stuff, yep.
And that allows us, I mean, we're dependent on you to
Mm-hmm.
bring that forward. It's just the way it's written is not a
I
true
don't have that
comment,
control.
so.
Understood.
Okay.
Yep, understood. One of our goals is also to create a strategic recruitment plan to include collaboration with local high schools, tech schools, and colleges, continued attendance at career fairs or hosting career fairs, open houses, we've had them, informational sessions. Going back to our EVP, we are modernizing our job postings to attract candidates, so making them a little more snazzy as opposed to just the simple job posting, saying who we are, what the position will do, how a candidate will succeed, and then why the candidate would love working here at Carroll County Government. We're updating our HR website with more in-depth information for job seekers and increasing our social media presence and expansion of where openings are advertised. And lastly, on this topic, we are looking to revamp the onboarding process for new hires. So we want to engage them pre-start date, eliminate our paper-based forms where possible, enhance their first day orientation, and then do post-start date check-ins. Ongoing stay interview program. We're looking at our exit interview program that we currently have to ensure we're collecting useful data and establishing a tracking mechanism to report that information back. Again, ties all into our enhanced metrics using the human resource information system, and then ongoing policy creation and any updates of Chapter 36 and 37. So that's in a nutshell what we plan to do for the recruitment, compensation, classification, and retention area of our department.
Really well said, in my view. I expect you have a timeline and objectives associated with each one of these, so you know when you're hitting a mark, and you keep moving forward, but
Yes.
really well established, so.
Our next area is career development and training. What we provided here is just a list of a few of the trainings that we offered to staff this year. We did training needs assessments with each department director to try to learn more about what they felt their employees needed. And we also updated the tuition assistance policy. In the future with career development and training, Robin is working with the community college to establish a Leadership Essentials certificate program. So our first cohort of that actually is going to start, we say mid, but it's actually be the end of January. And that's 7 courses incorporating both in-person and virtual or online offerings. And we have 20 staff that we worked with directors to choose that are going to go in that first cohort. So we hope to offer that a couple times each year. We continue to look for different offerings of trainings identified by the needs assessment or as matters arise. For example, one of the trainings we did was on proper investigations that arose out of some labor relations matters that we were addressing and wanted to make sure that managers had the tools to be able to address those investigations. And then we're collaborating with risk management and public works to revise the commercial driver training program, which is one that one of the positions that we do have a challenge filling. We've also livened up our employee engagement activities. There's a list there of some of the activities that we did. We produced the monthly Human Resource Happenings, HR Happenings newsletter, which we believe employees appreciate. And then on the next page, just a few pictures from some of the events that we've had over the year. Employees out having fun while they're here at work. Have to build that in. So future employee engagement, obviously ongoing, those activities, and the newsletter. We would like to start making regular visits to each department of, each station for the Department of Fire and EMS, just to get out there. We don't see them often. They come for orientation and know us at the beginning of their career, but then we're, not really interacting with them much. Would like to do, see if we can do some sort of a day in the life of, that we can spend time with employees and learn what they're doing. I think it would be helpful for the positions, job descriptions and things like that. And then also just continued implementation of the HRIS system to improve employee and management self-service experiences. And lastly, update on benefits and wellness. Again, just a list of some of the wellness events that we've done over the past year. We offered an enhanced dental plan as part of open enrollment, and we implemented a new flexible spending account administrator, also part of open enrollment. Those both will be effective January 1st. We were able to use wellness dollars that we receive as part of our contract with United Healthcare to provide wellness gifts to employees, tokens of appreciation, but also things that can be used for their own wellness. We did a bid solicitation, selection, and implementation of a new actuarial services provider, if you remember a few months back. And we also regularly provide 401k and 457 seminars and one-on-one sessions. As far as the future for benefits and wellness, this is one where we have a lot going on. The Time to Care Act is coming. Implementation of that begins in 2024. We have not seen the final regulations yet. They're expected out at the beginning of 2024, but the first piece of that is if you join the state plan, that employees and employers have to start contributing to that in October of 2024. So we need to determine whether or not we are going to move to an equivalent plan, which is either a private insurance or do it self-insured in-house, which I'm not recommending, or through the state plan. So that's one of our big future items. We also want to continue to review benefits eligibility and offerings to ensure the competitive edge that we have for recruitment and retention. Looking at the variety of plans offered, our co-pays and co-insurances, the administrative services performance guarantees, what the plan eligibility and contribution methodology is, what are employees paying for their benefits, and what, how do we get to those numbers. Our Medicare Advantage retiree plan bid comes open in 2024. That has actually been a large savings to the county, not only in the budget side of things, but also included with the OPEB calculations. So that is one that we certainly want to take a close look at and make sure that we're continuing to get the savings from that program. And design of a communication plan to continually encourage and educate employees on the use and aspects of benefits that are offered. Continuation of new and innovative wellness initiatives to engage our employees. We want to revise the benefits onboarding process to include that new HRIS system and eliminate a lot of the paper that we're using, build in those efficiencies for not only initial enrollment, but then for open enrollment. So the why. Why am I here telling you all of this? As you know, we continue to experience the effects of an active recruitment environment. It's highly competitive, and it provides many options to job seekers. This has, the challenges that we've had have been continued vacancies and reduced applicants in hard-to-fill positions in the skilled trades, CDL drivers, specialized areas like engineers, the county attorney, financial system administrator, and public safety, 911, and the Department of Fire and EMS. We will make offers, we'll get counter offers because individuals have a couple offers sitting at their plate, and then we'll make an agreement to bring them on board, and right before they're ready to start, they decline the offer. We have current employees seeking work elsewhere due to a lack of clear path for career advancement and predictable pay increases, which again, I understand are not in our control, but something that they do put into their toolbox. And considerable importance put on the work-life balance and the variety of benefits that we offer here. So the positive initiatives that have come about here at Carroll County over the last several years, not just this past year, have certainly made an impact. There were increases given back in August of 2022. However, we know that there's more work to do, and we want to be able to successfully recruit and retain employees that provide those vital county services. Any questions from me?
Any comments? The, very well done slide deck, and, the August 2022 movement, increasing compensation was very valuable to close a donut hole that was being created. and allow us to be more competitive. It's not always about money, but money sure helps. You know, I said earlier today during my town halls, I was supported with staff, with some of my colleagues, and what impressed me the most was their commitment to the community. So therefore, our commitment to the community. It's not a part-time job. It's not a, 9-to-5 job. It's a 24/7, how can I support our community best? And that's the message that I see Carroll County government as a whole. Now, not everybody says thank you, and that's okay, because like, Commissioner Kyler says, we are complaint-driven on many of our actions in the community. So it's difficult for folks to say thank you when they're, frustrated in many cases. But, this is a really good design. And, those pictures, going to events with employees, I mean, there's nothing better than sitting down with, guys in yellow vests that are taking a couple hours of their time to come over and get some chow and just sitting with them. And them seeing me and having that interaction, it's great. So you do, and your team does a great job in putting those together, so.
December 20th is the next
Yes,
get-together,
is the
holiday luncheon,
Holiday
yes.
luncheon.
To that end, the board has, is quite willing, very, very eager to close operations for the 3 hours during the.
Thank
Except
you
for
all.
you. Except for you.
You'll be busy
Yeah,
anyway.
right.
You talked about vacant positions, and I'm sure individual departments are evaluating. We probably have some vacant ones that never need to be filled, and we need to adjust that. But overall, how do you think in the last 12 months vacancies, have we improved? Is it about the same? I mean, it's a tough market out there.
I think we've improved. It's hard for, I think some of the positions that have been out there for a while, we were able to fill a few of them, and I can't think of the
Good.
ones off the top of my head right now, but we were able to get staff in.
Surveyor, for example.
Surveyor, okay. So there were some that we were able to, we always have those difficult positions. The 911 dispatchers, very, very difficult. Now we're seeing it with the paramedics for the Department of Fire and EMS. Public Works has always got a list of openings. So, we're trying to, what we want to do is hone in on those roles that are very difficult to fill, those departments that have those continual openings.
Yeah.
And what can we do there?
Okay. Any other comments for this information only? Okay, thank you so much.
you.
Thank you very much.
Thank you very much.
Move right into the bid approval and contract award of health and welfare consulting services.
Have a good afternoon.
We're staying.
Oh, okay.
Go
You have a good
Robin
afternoon.
and I are
do a
staying.
podcast or something.
Good afternoon, Commissioners.
Good afternoon.
The Office of Procurement, in cooperation with the Department of Human Resources, received 3 proposals for the above service, which is the Health and Welfare Consulting Services. The Evaluation Committee conducted a technical and financial review of the proposals based on the criteria detailed in the RFP. An in-person oral presentation by the top 2 ranked proposers were then presented to the Evaluation Committee. The Evaluation Committee scored Bolton Partners as the highest-ranked proposer and is therefore recommending Bolton for award of this contract for the Health and Welfare Consulting Services. And I will turn it over to Christy and Robin to answer any of your questions.
So a much shorter presentation here. Going through the scope of services for the RFP. You can read that there for yourself, but really what we were seeking is a broker consultant that's going to be able to assist us with looking at our benefits programs and making sure that we are in line with offering the benefits that our employees want and they are most cost effective for the county. So most importantly, though, this role actually is going to help us with this Time to Care Act implementation. So as many of you know, MACO has formed a consortium. We did not initially join that consortium because we don't know the regulations yet. So we want to take a look at the entire program before we decide whether the MACO program is the way to go, or whether to get our own private insurance, or to go with the state program. Notice how I left out the self-insurance part of that. So Bolton was selected because of their involvement in the Time to Care Act to this point. They're very, very involved in the regulation processing and making sure they understand that. That's one of the goals of the health and welfare consultant. The other ones is, again, just looking at what benefits we're choosing. We offered that enhanced dental program this year, and we had a good turnout for that. But is that really what employees want?
Right.
We have great medical coverage with very low copays, and my goal is not to upset that, but to see what other options are out there. Does a high deductible plan make more sense? Are employees coming into the workforce today not really concerned about health care? They would rather see that money in their paycheck. So really taking a look at what we offer, working with the vendors to do working with us first to prepare the bid specifications, and really make sure we're getting the best bang for our buck with the vendors, holding their feet to the fire, making sure they're performing as we need them to. Prescription benefits is one area that we really need to take a look at. As you know, those costs continue to grow. There's different generics and different ways you can fund programs and things like that. What do our employees pay out of their paychecks? Taking a look at that. What's our mindset for that, and preparing that for you to make a decision on. And then the Medicare Advantage retiree plan bids. So, we had a whole list of things for the consultant to go through, some of the, helping us with wellness initiatives and things like that. As Maureen said, we had 3 responses. We did do in-person interviews with 2 of them, and we're recommending Bolton due to their involvement in the Time to Care Act, their history of involvement with Carroll County. They've been here for several years on an ad hoc basis, so we've used them here and there to help with our bids, but they really have not been a day-to-day person that we can go to with strategic planning. And their annual consulting fees for the quoted scope of services is $118,750 per year. That's a 2-year rate guarantee, and that funding would come out of the Internal Services Fund. So there's a current budgeted consultant fee in our budget of $30,000. We would use that to offset it, and then the entire cost would come out of the ISF.
Okay. Any questions on this one?
Motion to award the contract for health and welfare consulting services to Bolton.
Second.
I have a motion, I have a second. 2 years is enough?
We're going to start with that,
Okay.
and then we're going to see where we need to go.
Yeah.
It's a new venture for us. We've never had this type of
Right.
arrangement before, so we want to see how it's going to go.
Okay. Okay. Any discussion? Seen here, none, all in favor?
Aye.
Thank you so much.
Thank you, guys.
Thank you very much. Have a good
Maureen,
afternoon.
are you gonna
Now
be
have a
there?
good afternoon.
Ryan's
Now I can go. Thank you.
flowered shirts.
Did I what?
Ryan, come on up here. He just, he's got the good-looking flowered shirt.
The purple one.
The red.
Looks pretty good to me.
It does. It's retro. I like it.
All right.
If retro's the right word, I don't know.
Good afternoon.
Good afternoon.
Yeah, same to you. Good afternoon.
Works out well for me that my wife picks out on my clothes, so that's where it comes from.
Go ahead, Ryan.
All right. The Office of Procurement, in cooperation with the Bureau of Facilities, is requesting your approval to use term contractor Advanced Heating and Cooling for the removal and installation of 2 condensers and 2 air handler units at the detention center in the amount of $42,580. This contract includes all supplies, equipment, and labor. This amount is within the project budget, and no additional funds will be needed.
Good afternoon, Commissioners. This project that Facilities will be doing, we'll be replacing 2 McQuay air handlers and 2 York condensing units at the detention center. The McQuay units are no longer in production and have to be retrofitted with a unit called Magic Air evaporator and a York condensing unit. The existing units have been in service for over 30 years and reached their end of life. Advanced Heating and Cooling has been successful doing installation for us in the past on HVAC equipment. One other project they actually completed for us was at the detention center, almost a mirror project. So if you have any questions, Thad Highlander's here today. He is the project manager on this particular job, so he can answer any questions you may have.
No, 30 years is a pretty good lifespan, so,
Absolutely.
okay.
Motion to award a contract for the supply, removal, and installation of 2 condensers and 2 HUs to Advanced Heating and Cooling in the amount of $42,580.
Second.
Got motion second, any discussion? Seeing here none, all in favor?
Aye.
Okay, let's talk about purchase of replacement.
Thank you, gentlemen.
Dissolved air flotation recycle pump for Freedom.
Air flotation recycle pump.
Okay, Carrie, those aren't flowers.
They are flowers.
They are flowers?
Yes.
Okay, it's a flowery type of day.
It is a flowery day in procurement.
For the record, I'm not wearing any flowers.
Okay, just, you know.
Hold it against him, though.
That's right, Carrie will have to carry the weight on this one, so.
Absolutely.
Go ahead, Carrie.
The Office of Procurement, in cooperation with the Bureau of Utilities, requests your approval to award a contract for the purchase of a replacement DAF recycle pump for the Freedom District Water Treatment Plant to Motor Technology Incorporated of York, Pennsylvania, in the amount of $49,612. This purchase will be made through a term contract. The proposed amount is within the adopted budget.
Gentlemen, the new Freedom District Water Treatment Plant became operational in 2009. The plant is staffed and operates on a 24/7 basis. Many of the components of the plant date to 2009 and are reaching the end of their useful lives. The DAF recycle pumps fall into this category. There are 2 DAF trains that are part of the plant. Because of the failure of one of the 2 recycle pumps, one of these trains is offline at this time. From a financial standpoint, it is much better value in replacing the entire pump at this time rather than piecemealing repairs over the next several years. As per the briefing paper, there are 2 major functions of the recycle pump. The first is to add processed water to the air saturator, and the second is to send the saturated water back to the head of the DAF train. The main purpose of the DAF train is to remove the organics from the raw water. With the service area's current demand of approximately 1/2 of the capacity of the plant, the single remaining DAF train that is online is meeting the needs for the service area. And then just to let you know, further complicating matters is the lead time for this pump is about 23 to 25 weeks. That's on par with most of the larger equipment that we've ordered in recent past, and we don't expect that to get better anytime soon. My plant staff does have a backup plan in place in the event of failure of the second recycle pump. And I should not have said that out loud, but and there is a plan. So
Good to know there's a contingency.
So with that, any questions for me?
You know, I think it's either sad or good that I actually understand this, but I think I'll take it as good. So I'll move that the Board of Commissioners award a contract for the purchase of a replacement DAF recycle pump for the Freedom District Water Treatment Plant to Motor Technology Incorporated in the amount of $49,612.
Second.
Got a motion, got a second. Any discussion on this one? Seeing here none, all in favor?
Aye.
Okay, let's talk about the Hampstead wastewater treatment plant.
The Office of Procurement, in cooperation with the Bureau of Utilities, requests your approval to award a contract for engineering services for improvements to the Hampstead wastewater treatment plant to JMT of Hunt Valley, Maryland, in the amount of $795,530.37. This contract award will be made via open bid. The proposal amount is within the adopted budget, which includes both FRF and State of Maryland grant funding. As per the table below, 9 proposals were received during the initial phase. These proposals were evaluated and then were shortlisted with the highest ranking 3 firms. JMT was the highest ranking firm following review and presentation of each firm's technical proposal.
So gentlemen, even though the Bureau completed a substantial upgrade of the Hampstead wastewater treatment plant in 2021, there were 3 areas that were not included as part of the upgrade. These areas include headworks improvements to the plant's old influent line. So basically what happens there is the original plant layout, all of the influent flow came in through what is now called the old influent line. With the upgrade, about 80% of the wastewater flow comes into the upper part of the plant. 20% still comes in through the lower end, and that lower end, there's no formal treatment process that takes the rags and larger clunky matter out of the wastewater stream prior to it entering the treatment process, and that has led to some pump clogs and so forth. The second area includes expansion and modifications to the existing sludge press building. We are currently operating with a single sludge press, and it is not doing the job that it needs to be done. Most modern wastewater treatment plants operate with 2 sludge presses. We have a model in mind that we are looking towards adding to the plant for this part of the improvements. We are pretty excited about that possibility. And the final area is the replacement of 2 polyaluminum chloride storage tanks and ventilation improvements to the building that currently house them. The tanks that we currently have are inoperable at this point in time. We have temporary rental units in place. Our goal is to take the existing tanks out of that building, have new modern tanks installed, and make that process work a lot better. As Carrie mentioned, part of what Carrie mentioned, the previous board approved the use of federal FRF funding for this project, and the Bureau has also secured a separate State of Maryland grant award for this project. The FRF money assigned to this project is $3 million, and the state grant is $500,000. This item is for consultant services for the design, engineering support, and construction management services for the overall project. JMT is a very well-established firm in the Baltimore metro area. We have worked with this firm many times in the past with very good results, and we fully expect that to continue with this project. Plan developments and permits will take approximately 1 year to finalize once we issue the notice to proceed for this contract. Following that, the construction project will then be advertised for bid and construction. And with that, any questions for me?
Kenny, you want to take this one because it's Hampstead?
Sure. I move the Board of Commissioners award a contract for engineering services for improvements for the Hampstead wastewater treatment plant to JMT in the amount of $795,530.37.
Second.
I'm not sure about that 37 cents, but.
Yeah.
Any discussion on this? Seeing here none, all in favor?
Aye. It's a very
Okay.
specific cent amount.
Okay.
Thank you,
Thank you.
gentlemen.
Thank you.
Okay, let's talk about Roberts Field restoration.
Good afternoon.
Good afternoon.
So we are requesting your approval to submit an application to the Department of Natural Resources Chesapeake and Coastal Grants Gateway for $1 million to help fund the conversion of the Roberts Field Stormwater Management Facility to an innovative wet pond submerged gravel wetland facility. This project will address our nutrient reduction requirements of the NPDES permit, and we are working in cooperation with the town of Hampstead, who is the owner of the site. Back in April, you guys approved the submittal of an application to the National Fish and Wildlife Foundation for $500,000. Those decisions were supposed to be made in September, but we received word that they won't be made until the beginning of 2024. So that application is still pending. So this would be an additional $1 million towards the project if we were awarded. Do you have any questions?
Have we already, that $1.2 million has already been contributed? That's already
We have that
county?
in our CIP.
Right.
As a plan for this project, yes.
Okay.
Commissioner Clyro, you want to take this one too?
It's in the CIP for FY.
25 for construction.
So we approved it last year?
Yes, as part of the 5-year
Right.
plan,
Yep.
so.
Okay. Okay.
I move the Board of County Commissioners approve the submittal of the grant application and acceptance of award to the Department of Natural Resources Chesapeake and Coastal Grants Gateway for the Roberts Field Restoration Project.
Second.
I have a motion, I have a second. Any further discussion on this one?
I do have.
Yeah, please.
I mean, we're going to see this again here in a second. Regardless of whether it's these types of projects or others, I guess I just feel as though if we're going to request a grant and then have to come up with our own money for a project, I want to have a really clear understanding that it's a necessary project.
So this project, this restoration project, as Kelly mentioned, will help with the county meeting their total maximum daily load requirements. So we're looking at reducing the nutrients that are making their way into the local waterways. But we also have an obligation for the county's NPDES permit to treat by December 30th of 27, 1,217 acres. This project is in our plan to meet that goal for our NPDS permit. So as I think this one will provide us with 22 acres. There is also, for this particular project, Maryland Department of the Environment has identified the existing pond, the embankment, as one of concern. So it's one of those where we're able to address several issues as part of our restoration projects.
And the original pond was constructed in 1987.
Okay, any further discussion? Seeing here none, all in favor?
Aye.
Aye.
Okay, let's move on to Carroll County Public Safety Training Center Stormwater Retrofit.
So we are requesting your approval to submit an application for $1 million to the Chesapeake and Coastal Grants Gateway to retrofit the existing stormwater management facility at the Carroll County Public Safety Training Center. This project will address the county's requirements under the NPDS permit, but it will also address Maryland Department of the Environment concerns regarding PFAS contamination on the site. The commissioners included a $1,500,000 request for funding for this project in their August 31st letter to Secretary Grady under the legislative bond initiatives. So this would be an additional $1 million that we're requesting to fund this project.
So we had staff from Maryland Department of Natural Resources out at both sites about a month ago because they do want to make site visits to projects that are going to come before them so that they can, I guess, have a better understanding of what we're looking to do for this project. So this is a project that we are working cooperatively with the Bureau of Building Construction on as they have planned improvements for the Fire Safety Training Center there. You know, as part of our retrofit, it will bring the facility up to current standards and allow their on-site requirements for stormwater management to be reduced considerably, looking at this facility as a regional facility. It will also provide future treatment if and when the Youth Service Bureau goes to expand. We are building that treatment into this facility as well.
Tom, do you want to take this one? Because it's, I'm trying to be district friendly.
I move the Board of County Commissioners approve the submittal of the grant application acceptance of award to the Department of Natural Resources, Chesapeake and Coastal Grants Gateway for the Carroll County Public Safety Training Center Stormwater Retrofit.
Second.
I have a motion, and I have a very gentleman second. Any discussion on this? Seeing here none, all in favor?
Aye.
Thank you.
Absolutely, thank you. Wanda, why don't you come on up? Chris, is there anybody on the phone?
I have no one waiting on the line, sir.
Okay. Mr. Hines, do you have any public comment?
I do not.
Okay. Okay, Wanda.
How are you, Wanda?
Good. How was
Number
everyone?
Doing well,
one,
thank you.
first week of December, December 4th, nothing scheduled. December 5th, the Maryland Association of Counties Winter Conference at the Cambridge. Commissioners Gordon, Kyler, and myself will be attending. At 5 p.m., we have the county holiday tree lighting ceremony in front of the county office building. On Wednesday, continuation of the MACO Winter Conference. And then Thursday, again, the MACO Winter Conference. Once again, there is no open session on Thursday, December 7th. And it is a Pearl Harbor Day, December 7th.
Right.
5 p.m. That afternoon is the delegation meeting down in the Reagan Room 003, where the District 5 and 42 delegation will be present, and I believe Commissioner Guerin and Vigliotti will be attending that. Catherine's Cause at the Ascension Episcopal Church down in Westminster. Commissioner Guerin will be attending at 7 p.m. On Friday, December 8th, we'll be finishing up MACO And then 8:30 that morning, there's a symposium for a Stronger Carroll Exploration Commons in Westminster. Commissioners Gordon, Garin, and Vigliotti will be attending. That's right, that's the one where Ben Carson has also been invited to speak. Let's see. Saturday, December 9th, there is no Mako. Mako actually is going to be completed Friday morning, and that's really,
By Friday
yeah,
midday.
I have a board meeting that morning, but yeah, there is no Mako on Saturday. 7 a.m. Carol and Tech breakfast with Santa. Somebody will be attending, I would expect, but don't know. December 10th, Sunday, Commissioner Gordon has the podcast, and I'll be attending a Hanukkah brunch at the Governor's State House at 10 a.m.
Oh, that'll be cool.
It will be cool. Monday, December 11th, is the Fire EMS pinning ceremony at 7 p.m. Currently got Commissioner Gordon, Kyler, Vigliotti, and myself attending. On Tuesday, December 12th, is the Ag Center Board meeting. Currently, I have myself attending. I'm going to talk to you about that as well on the 12th. December 13th, Farm Museum Board meeting. Commissioner Vigliotti will be participating in, and then Chamber of Commerce holiday party. Commissioner Gordon will be attending at the Antrim,
I'll be there as well for that,
and along with Commissioner Vigliotti.
in a tuxedo.
I don't want to know. All on you. There's a Board of Education meeting at 5 p.m. that afternoon. Don't see anybody attending that. And then also at 5 p.m. is the Carroll Community College Board of Trustees meeting, where Commissioner Kyler will be attending. Thursday, December 14th, we do go into open session. We'll have a election of the Board of County Commissioners officers, item number 1. And then go into public hearing of transfer of 2 lots at Sullivan and Snowden Way to the ARC of Carroll County. Talk about the approval to purchase and upgrade to the computer-aided dispatch, the CAD system. Ms. Hawkins, EMS, will be just walking us through that. We'll go through exercise option to purchase the David Russell Feeser and Barbara Feeser property through the county program. Construction services for the Carroll County Farm Museum Barracks Barn Roof. Contract award 2023 pipe culvert and storm drain rehabilitation. Then purchase of replacement diesel generator for Pine Hill wastewater pumping station. Contract award cleaning and lining sewage laterals at various locations around the county. Contract award installation residential water main meter vaults on Harlan Lane. Grant and acceptance of the award of Maryland State Home Stretch Difficult to Serve Homes Grant. Okay. Then we'll go into close for land acquisition. That evening is the Carroll County Chapter MML, the Maryland Municipal League dinner. Currently, we have Commissioner Vigliotti attending that. I will be attending the Fort Meade Alliance President's reception that evening as well. Friday, December 15th, nothing scheduled. December 16th is Wreaths Across America. Commissioner Kyler will be at the Emmanuel Lutheran Church in Manchester. Commissioner Gordon will be at the Meadow Branch Cemetery in Westminster. I will be at the Springfield Cemetery in Sykesville. So if we know where the others are going to be.
I'm going to be in Keymar, but I have to double check the location. So
Yeah, I'll be in Mount Airy. Pine Grove Chapel.
And then Commissioner Curran has the podcast on December 17th. Okay, we good?
Yes, sir.
Wanda? Okay. I need a motion to go into closed for land acquisition, and then a motion to adjourn after that.
So moved.
Second.
Okay. And let's say we take 15 minutes before we start closed, and we have food in there, right?
Yeah, we have people in there too.
We have people in there too. Okay, well, we're going into closed. All in favor?
Aye.
Aye.